Recording in progress.
Third ISHIM participants rules. 1. Participants log into the meeting room using an account with their full name in the format of full name and title if any institution. Example, Iuni Nisa Utami Unjaya. Please do not use pseudonyms or abbreviations. The host will approve the participant according to the registrant's data. 2. Please log in at least 30 minutes before the activity starts. 3. Participants wear polite clothes and behave politely during the third ISHIM activity. 4. Participants are required to make a presence on the attendance form. The link will be shared by the host when the event starts. 5. Participants are also required to fill out an evaluation form by attaching evidence of attending the seminar in the form of screenshots on Zoom or live YouTube during the seminar. Note, the link will be shared by the host at the end of the event. 6. During the activity, participants are not allowed to activate the speaker or microphone mute to support the event optimally. Participants can activate the speaker or microphone or press the raise hand button in the discussion session. 7. Participants who enter the Zoom meeting must turn on the camera during the third ISHIM activity. 8. The participants can ask questions that are written briefly through the chat room with the format full name institution spoken speaker question. Note, not allowed to spam chat and send anything other than questions. 9. The participants can join the seminar via online by Zoom meetings or live YouTube HIMARMIKA Unjaya official account. Note, YouTube HIMARMIKA Janai Yike. 10. All participants are expected to follow the activity until the end. 11. Participants who are not attend the seminar until it is finished will not get a certificate, as well as participants who not fill out the evaluation link at the end of the session.
Bikin cetar harimu dengan Red A. Kapanpun, dimanapun, Red A. Ready to win your day. Win your day with Red A. Hey Bestie, mau tahu perawatan Simple Go ala Red A Kosmetik? Yes, yang pertama, kamu harus tahu kenapa sih pembersihan itu penting? Gak mau kan wajah mudamu tampak tua? Atau jerawat dipupuk hingga subur, hingga berlobang mungkin? Nah, ini salah satu manfaatnya agar wajahmu terawat sedari muda sebagai investasi kulit tetap awet muda. Yuk, langkah awal, kenali jenis kulitmu. Yang pertama, kulit normal. Kulitnya terasa lembut, kenyal, segar, lembab, pori-porinya tidak membesar dan hampir tidak ada keluhan jerawat. Yang kedua adalah kulit kering. Kulitnya terasa kering, tidak kenyal, kasar, dan tampak kusam. Pori-porinya hampir tidak kelihatan dan cenderung mengalami tanda-tanda penuaan dini atau biasa kita sebut dengan keriput. Yang ketiga adalah kulit berminyak. Kulitnya terasa tebal, berminyak, tampak mengkilap, pori-porinya cenderung besar dan sering memiliki problem jerawat. Dan yang terakhir adalah kulit kombinasi, di mana pada bagian T yaitu dahi, hidung, dan dagu berminyak atau tampak mengkilap, sedangkan area pipi normal atau kering. Yang mana nih jenis kulitmu? Next, ketahui permasalahan kulitmu, berjerawat atau tidak berjerawat. Jika berjerawat, kamu harus ekstra hati-hati karena jerawat ini bisa timbul karena hormon, kebersihan sekitar seperti area rambut, poni, bantal, kasur, dan seringnya memegang wajah dengan tangan kotor. Ini adalah pemicu jerawat. Satu lagi nih, kalau berjerawat jangan sekali-kali dipencet ya, biar nggak berlubang seperti hatiku. Yuk langsung ketahui caranya. Langkah awal, lakukan pembersihan dengan Red A Cleansing Milk. Red A Cleansing Milk ini berfungsi untuk mengangkat debu, kotoran, minyak yang pastinya bisa menyumbat pori-pori. Kedua, gunakan Red A Face Tonic. Red A Face Tonic ini berfungsi untuk mengangkat sisa-sisa cleanser, mengembalikan pH kulit, dan menjaga kesegaran kulit kita. Jika kamu merasa kurang bersih sambil mandi, boleh gunakan facial foam. Tentunya sesuaikan juga dengan jenis kulit kalian ya. Jangan lupa akhiri dengan menggunakan face tonic supaya pH kulitmu kembali normal. Berikan nutrisi dan lindungi kulit wajahmu dengan Red A Moisturizer. Selain melembabkan, juga sudah mengandung UV filter. Pastikan gunakan Red A Moisturizer karena ini adalah salah satu perawatan yang sangat amat penting untuk menghindari flek hitam di wajah. Nggak mau kan wajahnya bertotol-totol masih muda? Eits, jangan lupa ya, untuk kalian yang berjerawat, kasih nih Red A Acne Cream, biar jerawatnya kempes dan kering. Untuk tampilan fresh sehari-hari sebelum berangkat sekolah, jangan lupa Red A Loose Powder. Red A Lip Glow Color Balm menggabungkan fungsi lip balm, lipstick, dan lip gloss. Untuk sehari-hari, aku pakai warna Sparkling Rose nomor 500. Nah, untuk jalan-jalan, aku suka warna yang ini nih, 504 Purple Punch. Miliki semuanya ya, 6 warna. Untuk tubuhku, aku gunakan Red A Beauty Lotion Whitening agar lembab dan melindungiku dari sinar UV. Simpel kan? Lakukan perawatan ini setelah pulang sekolah juga ya. See you next time, Bestie, di tips berikutnya.
Tes 1 2. Tes 1 2. Oke. Ibarat
too late. Took so long.
Good morning, ladies and gentlemen, and welcome to the third ISHIM International Seminar 2022. The Honorable Representative of Association of Indonesian College of Medical Record and Health Information, Mr. Dian Budi Santoso, MPH. The Honorable Representative of Indonesia Professional on Medical Record and Health Information Organization of Yogyakarta, Mr. Suryo Nugroho Markus, MPH. The Honorable Vice Dean of Faculty of Health, Universitas Jenderal Ahmad Yani, Yogyakarta, Mrs. Ngatoyatu Rahmani, MNS. The Honorable Mr. Zakarias Kurnia Purbobinuko, MPH, as the Headmaster of Medical Record and Health Information Program in Universitas Jenderal Ahmad Yani, Yogyakarta. Mrs. Imaniar Seftiani, MKM, as Advisor of HIMARMIKA. The Honorable all keynote speakers and all of beloved guests who I cannot mention one by one. Let me introduce myself first. My name is Untaro Dudaharjo, as the Master of Ceremony for the third International Seminar of Medical Record and Health Information Management, with the theme Health Information Management, Medical Billing, and Coding. I'm delighted to say thank you for all participants and invited guests who have been joined virtually on Zoom meeting and YouTube channel. And we also thank you for Viva Cosmetics and the Sejuta Cita apps as a sponsor of this event. This international seminar was attended by some participants from several countries, namely Indonesia, Philippines, Malaysia, Thailand, United States, and Nigeria. Today we have 4 amazing keynote speakers. We have Mrs. Dr. Hozizah SKM MKM from Indonesia. We have Mrs. Nik Azliza Nik Arifin, PhD from Malaysia. Mr. Tanapong Intara, PhD from Thailand. And lastly, Mr. Zakarias Kurnia Purbobinuko, MPH from Indonesia. On this special morning, we have several agendas. Those are, the firstly is opening, and then praying, and the third agenda is singing the national anthem of Indonesia Raya and Mars Universitas Jenderal Ahmad Yani, Yogyakarta. The fourth is welcome speech. And the main session is presentation and discussion with all keynote speakers that will be guided by a beautiful moderator. and next conclusion, and the last is closing. And I beg your attention that in this webinar, we have door prize at the break session and the end of event. So don't miss it and stay tuned on this channel. The next event is praying that will be guided by Abi Alaiddin Haq. For Abi Alaiddin Haq, time is yours.
Assalamualaikum warahmatullahi wabarakatuh. Ladies and gentlemen, let us bow our head for a moment. Pray to God Allah Subhanahu wa Ta'ala so that our treat ISHIM 2022 with Tawfiq, Health Information Management, Medical Billing and Coding can be precious to all of us. I will let this pray based on Islam, and those who are not Muslim, you are blessed to pray according to age of your beliefs. Bismillahirrahmanirrahim. Alhamdulillahi rabbil alamin. Hamdan syakirin, hamdan na'imin, hamdan yu'afin nima'ahu wa yukafi'u mazidah. Ya Rabbana lakal hamdu kama yanbahi li zalali wa azikal karimi wa azimi sultanik. Oh Allah, today we gather here bring about trade ISHIM 2022. Make this event as full skin assembly as medium of sharing full ideas, knowledge and experiences of scholar, researcher and student of various disciplines. Oh Allah, protect us from united tension, show us the right path and give us knowledge and strength to perform good things. Equally, show us and make this clear the bad things and give us knowledge and strength to event them. Oh Allah, you are the one who can fulfill your doa. Rabbana atina fid dunya hasanah wa fil akhirati hasanah wa qina azabana. Wa sallallahu ala Muhammadin wa ala alihi wa sahbihi ajmain. Subhana rabbil izzati amma yasifun. Wassalamu ala mursalin walhamdulillahi rabbil alamin. Wassalamualaikum warahmatullahi wabarakatuh.
Thank you, Abi Alaik. Ladies and gentlemen, the next session is singing the national anthem of Indonesia Raya and Mars Universitas Jenderal Ahmad Yani, Yogyakarta. Participants either join on offline or online. Please be stand up. The welcome speech from the chairman of the third ISHIM International Seminar 2022 that will be provided by Aulia. For Aulia, time is yours.
Assalamualaikum warahmatullahi wabarakatuh. Om Swastiastu, Namo Buddhaya, salam kebajikan, salam sejahtera bagi kita semua. The Honorable Mrs. Dr. Insinyur Kiki Yuliati, Master of Science, as the Director of Vocational Schools, Ministry of Education and Culture of Indonesia. The Honorable Mr. Dian Budi Santoso, as representative of Association of Indonesian College of Medical Record and Health Information. The Honorable Mr. Suryo Nugroho Markus, MPH, as representative of Indonesian Professionals on Medical Record and Health Information Organization of Yogyakarta. The Honorable Mr. Dr. Andus Joko Susilo, STMT IPU, as Director of University Jenderal Ahmad Yani, Yogyakarta. The Honorable Mrs. Ngatoyatu Rohmani, MNS, as Vice Dean of the Faculty of Health, University Jenderal Ahmad Yani, Yogyakarta. The Honorable Mr. Zakarias Kurnia Purbobinuko, MPH, as the Speaker and the Head of Medical Record and Health Information Program in University Jenderal Ahmad Yani, Yogyakarta. The Honorable Mrs. Imaniar Septiani, MKM, as Advisor of HIMARMIKA. The Honorable all the speakers who are Mrs. Dr. Hosiza, SKM from Indonesia, Mrs. Nik Azliza from Malaysia, Mr. Tanapong Intara PhD from Thailand, all of participants. First of all, let us praise to God, who has given grace to all of us, so that today we can hold an International Seminar 2022. My name is Aulia, is Chairman of the Third ISHIM International Seminar 2022. We proudly present our seminar theme, which is Health Information Management, Medical Billing and Coding. We took this theme because health information management is a science that compels numerous aspects of health, such as health policy, health administration, regulation of health, management of health data, and information that supports other subsystems in order to ensure the achievement of the highest degree of health. The health information management is closely to medical billing and coding. Both of these issues are important to medical record practices to ensure that payment for patients is correctly paid according to healthcare service they created. The participants of the third ISHIM International Seminar 2022 are attended by 457 participants from several countries, which from Indonesia, Nigeria, Thailand, Philippines, and United States. Finally, I would like to say thank you for the committee who took their time and energy to make their third ISHIM International Seminar 2022 goes well. I also say thank you for all the speakers and all audiences who have been participants on this event. Hopefully, the international seminar will run smoothly as we expect. That's all from me. Om Santi 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 Om. Salam kebajikan. Wassalamualaikum warahmatullahi wabarakatuh.
Thank you, Aulia, for your warmly speech. The next is the welcome speech from the Vice Dean of Faculty of Health, Universitas Jenderal Ahmad Yani, Yogyakarta, Mrs. Ngatoya Rahmani MNS. Time is yours.
Thank you, Mr. Ontoro. Okay. Good morning. Assalamualaikum warahmatullahi wabarakatuh. May peace be upon you. The Honorable, the representative of HIMARMIKI, Mr. Suryo Nugroho Markus, SA, MPH. The Honorable, the representative of APMIKI, Mr. Dian Budi Santoso, MPH. And the Honorable, the Director of Vocational Education, Ministry of Education, Culture, Research and Technology, and distinguished guests, ladies and gentlemen. First of all, let us express our gratitude toward the Almighty Allah, where His blessings are always with us, so that we all can be attend this meeting virtually, actually, in good condition and health. And we would like to say thanks to all of the speakers from Indonesia and then Thailand, Malaysia, that for presenting with us today. Okay, and I would also like to express my appreciation for the committee for organizing this event for the third time. Okay, and on behalf of Rector Unjaya, we sincerely apologize because the rector has another schedule or meeting, so that cannot attend this seminar. However, we would like to welcome all of the participants to this third international seminar of health medical record, and health information. Okay. And hopefully, by this seminar, we will learn and gain knowledge. And I hope that and also these programs actually it's also related to the vision of the study program that's related to health medical record and also coding. And I hope that even will help us to grow ourselves professionally. And once again, welcome and thank you for attending this event. I wish all participants good luck. And for the last, as our Unjaya tagline, maju bersama, sukses bersama, Unjaya unggul dan terdepan. Thank you. Assalamualaikum warahmatullahi wabarakatuh.
For Mrs. Ngatoya Rahmani MNS. And the next is welcome speech from representative of Indonesia Professional on Medical Record and Health Information Organization of Yogyakarta, Mr. Suryo Nugroho Markus MPH. Time is yours.
Assalamualaikum warahmatullahi wabarakatuh. Shalom, Om Swastiastu, Namo Buddhaya, salam kebajikan kita semua. Selamat pagi dan salam sejahtera untuk kita semua. Good morning, ladies and gentlemen. Have a good health to all of us. Excuse me, I will speak Indonesia language. Pertama-tama marilah kita panjatkan puji dan syukur kepada Tuhan Yang Maha Kuasa atas berkat dan rahmat-Nya kepada kita semua, sehingga pada hari ini kita dalam keadaan sehat, tidak kurang suatu apa. Yang kami hormati Rektor Universitas Jenderal Ahmad Yani Yogyakarta atau yang mewakili beserta jajarannya, yang kami hormati pula Direktur Jenderal Pendidikan Kejuruan Kementerian Pendidikan dan Kebudayaan Indonesia atau yang mewakili Asosiasi Perguruan Tinggi Rekam Medis dan Manajemen Informasi Kesehatan Indonesia (HIMARMIKA) atau yang mewakili para narasumber, form speaker event today, Mrs. Nick Azliza Nick Arifin, PhD from Malaysia, Mr. Professor Christopher Tan from Japan, Mr. Tanapong Intara, PhD from Thailand, and Mr. Sakarias Kurnia Purbabinoko from Jogja, Indonesia. Pada hari ini, dan saya mewakili Bapak Sugeng selaku Ketua DPD Formiki Daerah Istimewa Yogyakarta, Yogyakarta Province, karena beliau berhalangan hadir. Kami mengapresiasi kegiatan ini karena ini merupakan salah satu kegiatan yang memang menjadi harapan juga dari keprofesian perekam medis dan informasi kesehatan. Kami menyambut baik seminar internasional ini, Medical Record and Health Information, dari Himpunan Mahasiswa Rekam Medis dan Informasi Kesehatan atau HIMARMIKA di Fakultas Kesehatan Universitas Jenderal Ahmad Yani Yogyakarta. Perlu kita ketahui, Bapak Ibu dan teman sekalian, bahwa saat ini dengan adanya COVID-19, semua bidang atau semua sektor berupaya untuk bertransformasi diri, bertransformasi baik itu dari sisi bisnis maupun organisasi dan sebagainya. Dan yang penting adalah transformasi digital sedang digalakkan, termasuk saat ini Kementerian Kesehatan sedang berupaya untuk melakukan transformasi digital melalui 6 pilar transformasi. Dan juga dari profesi perekam medis dan informasi kesehatan melalui organisasi profesi Formiki, juga di dalam perayaan ulang tahun yang lalu di ulang tahun 33, mendengungkan semangat bertransformasi. Karena saat ini tantangan profesi perekam medis dan informasi ke depan sangat berat, Bapak sekalian dan juga teman-teman, para hadirin sekalian.
Halo.
Bahwa tantangan ke depan dari profesi lain maupun dari, mohon maaf, apakah suara saya sudah on lagi?
Masih Pak Markus.
Ya, baik. Ya, tantangan kita ke depan sangat berat, terutama untuk transformasi digital saat ini, di mana profesi PMIK ini dituntut untuk paham dan juga mampu berkolaborasi maupun bertransformasi untuk bidang teknologi informasi, coding, dan juga peranan di fasilitas pelayanan kesehatan. Dengan masuknya tenaga informasi kesehatan di semua fasilitas kesehatan, ini mendorong kita profesi perekam medis informasi kesehatan untuk bisa atau dapat mengikuti apa yang menjadi kebutuhan dan juga menjadi cita-cita dari Kementerian Kesehatan. Formiki dalam hal ini organisasi profesi sudah bekerja sama ataupun menandatangani kesepakatan bersama dengan Asosiasi Pendidikan Informasi Perekam Medis Informasi Kesehatan atau HIMARMIKA bahwa profil lulusan ke depan adalah teknologi informasi kesehatan. Jadi dengan terbitnya Peraturan Menteri Kesehatan Nomor 24 Tahun 2022, di mana per 1 Januari 2024 atau paling lambat 31 Desember 2023, semua fasilitas pelayanan kesehatan mulai dari rumah sakit, puskesmas, klinik, praktek mandiri, apotek, dan juga laboratorium kesehatan harus sudah melaksanakan rekam medis elektronik, di mana pasien nanti juga dimudahkan melalui program Satu Sehat ketika pasien berobat di satu rumah sakit atau ke klinik, lalu juga berobat lagi ke klinik pada waktu yang bersamaan atau waktu yang berbeda, tidak perlu membawa berkas rekam medisnya, tetapi semua data ada di dalam satu sehat. Nah, proses-proses ini masuk ke dalam Indonesian Health Service atau satu sehat ini menjadi salah satu kompetensi rekam medis dan informasi kesehatan, di mana semua data tidak harus masuk ke satu sehat tersebut, tetapi dalam bentuk resume medis. Proses seleksi inilah yang akan dilakukan oleh teman-teman perekam medis dan informasi kesehatan yang ada di fasilitas pelayanan kesehatan. Jadi mudah-mudahan semua dapat dilalui fase-fase yang berat ini, baik kita di organisasi profesi di Formiki maupun teman-teman di institusi pendidikan dan juga adik-adik mahasiswa. Baik, mungkin ini yang dapat saya sampaikan. Selamat kepada semua yang terlibat, kepada Universitas Jenderal Ahmad Yani dan juga kepada Himpunan Mahasiswa Rekam Medis dan Informasi Kesehatan HIMARMIKA Fakultas Kesehatan Universitas Jenderal Ahmad Yani. Salam sukses selalu. Alright, ladies and gentlemen, thank you for your join in this event, and we hope this activity will be used for us. Thank you. Assalamualaikum warahmatullahi wabarakatuh.
Thank you, Mr. Suryo Nugroho Markus, MPH. The next is the next is welcome speech from representative of Association of Indonesian College of Medical Record and Health Information, Mr. Dian Budi Santoso, MPH. Time is yours.
Thank you. Assalamualaikum warahmatullahi wabarakatuh. Selamat pagi, salam sejahtera untuk kita semua. Om Swastiastu, Namo Buddhaya, salam kebajikan. Good morning, ladies and gentlemen. Allow me to deliver the speech in bilingual. Yang terhormat, The Honorable Rektor Universitas Jenderal Ahmad Yani Yogyakarta beserta jajarannya. Yang kami hormati perwakilan Direktorat Jenderal Pendidikan Vokasi, Kementerian Pendidikan dan Kebudayaan atau yang mewakili, kemudian yang kami hormati Ketua DPD Formiki DIY yang dalam hal ini diwakili oleh Bapak Suryo Nugroho Markus, and dear speakers and all participants in today's seminar. First of all, let's say thanks to God. Because of God's blessing, today we can attend this seminar on behalf of Mrs. Nuryati, the Chief of HIMARMIKA, our Indonesian Higher Education of Medical Record and Health Information Management Association. I'm greeting all of you with warm welcome in the international seminar on health information management hosted by Medical Record and Health Information Study Program, Universitas Jenderal Ahmad Yani, Yogyakarta. I hope that today's seminar can go well and smoothly. Highest appreciation, apresiasi setinggi-tingginya kami berikan kepada Universitas Jenderal Ahmad Yani, Yogyakarta for hosted this international seminar. I think it's a good example for other institutions to annually hosted international level event to broaden our knowledge, our experience, and our relation to the international level. Sebagaimana kita tahu, as we know that recently, ya baru-baru ini Ministry of Health of Indonesia, Kementerian Kesehatan Republik Indonesia baru saja merilis a new regulation about medical record, specifically related to electronic medical record implementation. Jadi baru-baru saja Kementerian Kesehatan Republik Indonesia itu merilis peraturan Menteri Kesehatan terkait dengan rekam medis, yes, spesifiknya terkait dengan rekam medis elektronik. And by 2023, di tahun 2023, all healthcare facilities in Indonesia must have implemented electronic medical record. Jadi di tahun 2023 itu semua vaskes Indonesia itu harus sudah mengimplementasikan rekam medis elektronik. Itu amanat dari peraturan Menteri Kesehatannya. Tentunya ini menjadi tantangan dan juga menjadi peluang bagi kita semua, bagaimana kemudian profesional perekam medis dan informasi kesehatan ini dapat menempatkan diri dengan baik di masa transisi ini. Ya, tadi Pak Markus menyampaikan digital transition ya. Kita sekarang sedang melalui masa transisi dari manual ke digital, bagaimana kita bisa menempatkan diri dengan baik, menyiapkan diri, dan tentunya juga bagaimana institusi pendidikan juga dapat merespon dengan cepat hal tersebut, sehingga kita semua bisa mengantisipasinya. And in today's seminar, we can learn many perspectives from Indonesia, from the speakers from Indonesia, Malaysia, Thailand, and other countries about how health information management or how health information ideally managed. Demikian yang dapat saya sampaikan. Mohon maaf jika ada tutur kata yang kurang berkenan. Semoga sukses untuk acaranya. Selamat dan terima kasih kepada panitia penyelenggara, Himpunan Mahasiswa dan Program Studi Rekam Medis dan Informasi Kesehatan Universitas Jenderal Ahmad Yani Yogyakarta. Sukses selalu. And finally, please enjoy and have a wonderful day. Thank you. Assalamualaikum warahmatullahi wabarakatuh.
Thank you, Mr. Dian Budi Santoso, MPH, for the speech. And now, we will be heading to the main session, which is presentation and discussion with keynote speakers. And this session will be guided by Mrs. Ristiana Eka Aringning Tias, MPH, as the moderator. Mrs. Ristiana Eka Aringning Tias is originally from Midwest, but she recognized that health issues in Indonesia and worldwide is not only can solved by clinical things, but also policy. So in 2018, I think, she traveled to health policy and management program in Universitas 11 Maret Surakarta. And she had joined in a lot of publication and community engagement, especially in the mother and child health and also policy, health policy, and now in the health information management. Ladies and gentlemen, please welcome Mrs. Ristiana Eka Arining Tias, MPH.
Okay, thank you very much, Mr. Untara. Good morning, ladies and gentlemen. Welcome to the third ISHIM. It is the International Seminar on Health Information organized by HIMARMIKA, Student Association of Medical Record and Health Information, Department Unjaya, with theme Health Information Management, Medical Billing, and Coding. My name is Ristiana Eka Arining Tias, and I'm going to be moderator today. And for your information, our participants are researchers, practitioners, and also students. So quite various background. The theme of the seminar is ways to bring up fresh ideas that can be applied. We hope that it can be a good forum for us in the implementation of knowledge advance. And today we have 4 speakers who are already with us. Mrs. Dr. Hoziza, MKM from Indonesia. Mrs. Nick Azliza Nick Arifin, PhD from Malaysia. Mr. Zakarias Kurnia Purbobinuko, MPH from Indonesia. And Mr. Sanapong Intara, PhD from Thailand. Mr. Zakarias and Mr. Sanapong will be joining with us later on. Ladies and gentlemen, we are apologize our speaker on behalf of Mr. Christopher Tan, unable to attend. Hopefully on the next opportunity he can attend to share knowledge with us. And now, I'd like to greet Mrs. Hoziza first. Hello, Mrs. Hoziza, are you with us?
Yes, I'm hearing you.
Okay, thank you. Glad to see you here.
Thank you.
Okay, ladies and gentlemen, I'd like to read a brief introduction to our speakers on first session. First, Mrs. Dr. Hoziza, MKM. She is a lecturer at Esa Unggul University. As one of the founders of the Management and Health Information Study Program at Esa Unggul University, which became the first Management and Health Information Study Program in Indonesia, she has completed some education. I have noticed there a lot of research, community service experience, and publication focused on antenatal care, and it's interesting. And she got an award as the best lecturer in publication. Okay. The next I will read profile from Mrs. Nick Aziza. Hello, Miss Nick Aziza. Are joining with us? Okay, Miss Nick Aziza will joining with us later. And I will read her profile first. From Miss Nick Aziza. She is currently work as a lecturer at Faculty of Information Management, University Mara. She does research in qualitative social research. She has attended guest lectures and seminars, not only in Malaysia but also at other campuses in Indonesia. Her current project is namely Songket di Raja Selangor, focused on Research Management Center. And her latest publication is Nurse Acceptance Use of Electronic Medical Records, EMR, in Selected Private Hospital Case Study. Okay, ladies and gentlemen, before the presentation begins, let me tell you how this seminar will run. Please make sure you activate your video and also your microphone when necessary. Firstly, our speakers will present the material till the next 2 hours, and to all speakers will talk around 30 minutes. And after that, there will be a 10-minute break. And after the break, the session will be continued with another presentation by the speakers. And after the speaker presented their topics, we will have discussion session for about 20 minutes. And finally, the session will be ended by a conclusion. And for all participants can ask questions. You can ask your question during session by typing your question in the chat box. And for those who have raised their hand to open the microphone, I will invite you at discussion session. And don't forget mention to whom your question is addressed. Ladies and gentlemen, without further ado, now allow me to welcome Mrs. Dr. Hoziza, MKM, to present the material ICD 11 for about 30 minutes. Please.
Okay, thank you, Miss Moderator, Miss Christiana. May I share my presentation, maybe? Okay. Okay. Miss Christiana, you can.
Hello? Yes?
Yeah.
Okay.
Yep. You can see my presentation?
Oh, no. You can share screen, Miss Hoziza?
Yes.
Oh, okay. We can see your material.
Okay. Okay. Thank you, Ms. Christiana, all of participants in the third ISHIM, organized by HIMARMIKA, Universitas Jenderal Ahmad Yani, Yogyakarta. In this event, I want to share about the international classification disease. The first of all, thanks for the organizing committee. The third is him to invite me to share about ICD-11. I hope you can understand and add knowledge about ICD-11. Yeah. In this session, I want to share about the ICD-11. The outline in this my presentation. The first, introduction to ICD-11. The second, the purpose and benefits of using ICD-11. The third, the structure of ICD-11. And the fourth, or the last, ICD-11 codes for COVID-19. The first time, I want to the introduction to ICD-11. Ladies and gentlemen, the ICD-11 may be one of the WHO family international classification. The background is the international classification of diseases has been the main basis for comparable statistics on causes of death and non-fatal disease. The seventh revision, or we call ICD-10, was released nearly 30 years ago. It serves a variety of functions in much of the world, at least 120 countries, and has been translated into 43 languages. The next, the ICD-11 revision adopted by the 22nd World Health Assembly in May 2019 after extensive consultation and deliberation address these shortcomings of ICD-10 and more. And ICD-11 is a different and more powerful health information system based on formal ontology, designed to be implemented in modern information technology infrastructure and flexible enough for future modification and use with other classification and terminologies. ICD-11 for mortality and morbidity statistic, or we call ICD-11 MMS, is the primary derived classification and the main successor to ICD-10. The ICD-11 fit for the digital age has been to base it on the computable knowledge framework. This is the most important difference between ICD-11 and earlier revision. We know maybe the earlier revision, ICD-10 and ICD-9 maybe. Introduction of the knowledge framework has enabled ICD-11 to be interoperable in digital health information environments. The ICD-11 can access in link ICD WHO and at international, maybe in English. You can use the website. You can use ICD-10, learn more, and be involved. Yeah, you can explore the ICD-11 yourself. Yeah, about ICD browser, ICD-11 coding tool, ICD API, ICD-11 implementation transition guide. Learn more, and you can find ICD homepage, maybe ICD-11 reference guide, and so on. Okay. Now, the purpose and benefits of using ICD-11. We know a suite of classification products, the WHO family of international classification exists to compile and compare health information in integrated comparable fashion nationally and internationally. Okay. The second, the concept of the family of international classification has been created to have common framework and language to report, compile, use, and compare health information at the national and international level. The family brings together different health classification dealing with various dimensions of health and healthcare so as to present a more comprehensive picture of health system. The next, the purpose family of international classification is health consists of reference classification, derived classification, and related classification. The reference classification covers the area of disease and related health problem, or we call ICD. Disability, we call ICF, and health intervention, we call common ICHI. And the international classification of disease, ICD, is tool for recording, reporting, and grouping condition and factors that influence factors. It contains categories for disease, health-related condition, and external causes of illness and death. Maybe the participant, all of student, maybe the practitioner of health information management or medical record and health information management practitioner, maybe you can know well ICD. Maybe in Indonesia, for this time, we use still ICD-10. The purpose of the ICD is to allow the systematic recording, analysis, interpretation, comparison of mortality and morbidity data collected in different countries or area at different time. The ICD is used to translate diagnosis of diseases and other health problems in an alphanumeric code, which allows storage, retrieval, and analysis of data. Okay. The purpose of ICD-11, you can see ICD-11 can use to public health cause of death, clinical terms record surveillance, functioning assessment decision support, primary care, prevention and research, patient safety, drug safety, and device safety. The last, cosmic costing resources of the DRG cancer registration. In Indonesia, maybe until now, we don't use ICD-11 yet. Okay. ICD-11 ensures semantic interoperability and reusability of recorded data for the different use cases beyond mere health statistics, including decision support, resource allocation, reimbursement guidelines, and more. All member states WHO are encouraged to follow their commitment to move on to the ICD-11 documented with their approval of ICD-11 at the 72nd meeting of the World Health Assembly in 2009. And use the most current version of ICD for recording and reporting mortality and morbidity statistics, both nationally and internationally. Okay. The structure of ICD-11. Yeah. Reviews, we share the website of ICD-11, International Classification of Disease 11 Revision, the global standard for diagnostic health information. I want consent to share about the ICD-11 reference guide. Maybe some student of the participants, you can know well ICD-11. You can visit in website WHO ICD-11 especially. You can visit ICD-11 reference guide. You can get ICD-11 reference guide. Okay, in this website, you can learn how to use this reference guide. Okay, this reference guide for ICD-11 is divided into 3 parts. While each part will contain information valuable for your understanding and use of ICD-11, each has been created to be relevant to your primary purpose for coming to the guide. Okay, if you are looking to gain a general, broad understanding of ICD-11 with little or no prior experience with ICD, we suggest is the main the WHO. Okay, WHO suggests you start with part 1. Okay, you can access the part 1, an introduction to ICD-11. But if you can looking to understand how codes are created and the detail of the organization behind ICD-11, we suggest you start with part 2. Yeah, you can access part 2 using ICD-11. If you are already familiar with ICD, maybe you are a HIM practitioner or medical record and health information practitioner at working in hospital, maybe in primary healthcare. Okay, particularly if you have used ICD-10, sorry. Okay, we suggest you start with part 3. Okay, to see what is new and what has not changed in ICD-11. Okay, you can visit or access part 3, new in ICD-11. Yeah, you can find the different ICD-10 between ICD-11. Okay. The content model in ICD-11, the main properties of the content model are the first ICD concept title. Okay. The second, hierarchy, type, and use consists of parents, type, and use. Okay. The third, textual definitions, consists of description, in short, definition, and long statement or long description. The fourth, terms, consists of index term, synonym, inclusion term, and exclusion term. The last of the fifth, clinical description, consists of the body systems, body parts, anatomical site, manifestation properties, consistent and symptoms, findings, causal properties, etiology type, infection or agents, injury mechanism, risk factors, genomic characteristic, temporal properties, several properties, functional properties, specific condition properties, treatment properties, and diagnostic criteria. Okay. Now, the ICD-11 code structure. Okay. The codes of the ICD-11 are alphanumeric. Different between ICD-10 and ICD-11. Okay. Alphanumeric and cover the range from first the 1A00.00 to ZZ9Z.00. These are referred to as STEM codes. The structure of STEM codes is described below. The first character, the one of the codes always related to be chapter number. Okay, it may be a number or letter. Okay, codes starting with X. If you can, X indicate an extension code. There is always a letter in the second position to differentiate ICD-11 codes from the codes in ICD-10. The inclusion of the first number at the third character position prevents spelling undesirable words. The letter O and I are omitted. Jadi dihilangkan untuk O dan I ya. To prevent confusion with the number 0 and 1. Jadi untuk mencegah supaya tidak membingungkan dengan angka 0 dan 1. Maka O ya, abjad O dan I itu ditiadakan. Oke. Okay? Nah. Alphanumeric codes cover the same statement previously. Codes starting with an X indicate the extension code. Okay. Okay. The same statement. The first character of the code always related to the chapter. The first character of 1 to 9 is used for chapter 1 through 9 and for chapter 10 through 29. The first character is a letter. Okay, the code range of single chapter always has the same character in the first position. For example, 1A00 is a code in chapter 01. Okay, and BA00 is a code in chapter 11. Okay. Okay. Maybe the participant you can use the ICD 10 for this time, maybe different in the ICD 11. Okay. The extension code chapter X previous, yeah, you can overview of the type 1 extension code, yeah, consists of the severity scale value, temporality, cause of the condition, etiology, topology, scale value, anatomy and topography, histopathology, dimension of injury, dimension of external cause, consciousness, substances, ICD, or health devices, equipment, and supplies. Overview of type 2 or second extension codes, diagnostics code descriptor. Okay, consists of the diagnosis type, diagnosis timing in relation to surgical procedures, diagnosis method of confirmation, diagnosis certainty, obstetrical diagnosis timing, encounter descriptor, capacity or context. Okay. Okay. In this presentation, I want to give you example ICD-11 codes for COVID-19. Okay. ICD-11 codes for COVID-19. There are three categories for COVID-19. Yeah. Diagnosis, the first diagnosis, the second prevention, and the third post-COVID-19. Okay. Now, the diagnosis, you can find maybe COVID-19 virus identified. Jadi jika ada pasien sudah teridentifikasi COVID-19, ya, virusnya teridentifikasi. Nah, kalau yang warna hijau ya, the green color, coding in ICD-10. And blue color, coding in ICD-11. Okay. In ICD-10, you can find U07.1. Okay. And the ICD-11, you can coding number for the patient COVID-19 virus identified. You can get a code RA01.0. Okay. If the patient COVID-19 virus not identified in ICD-10, you can get U07.2. In ICD-11, you can code RA01.1. Okay. And if the patient multi-system inflammatory syndrome associated with the COVID-19, in ICD-10, you can get the U10. And the ICD-11, you can RA03. Okay. If patient post-COVID-19, in ICD-10, you can get code U08. And ICD-11, you can get code QZ42.0. Sorry. Post-COVID-19 condition. Okay. If you find the specific condition, you can get the code U09 at specific condition, and 11 ICD-11 you can get RA02 at specific condition. Okay. If patient visit to hospital on other healthcare for prevention, example, need immunization against COVID-19, you can get code in ICD-10 U11 and ICD-11 you can code QC01.9. Yeah, add vaccine code. Okay. If patient visit hospital or healthcare adverse reaction to a COVID-19 vaccine, you can get code in ICD-10, you can code U12. Okay. And ICD-11, you can get code adverse reaction or PL00 plus vaccine code. Okay. This is the sample, the difference ICD-11 codes between ICD-11 10. Okay. Okay. You can access the ICD-11 coding tool. Yeah, you can visit. You can search COVID-19 in this section. Yeah, you can type COVID-19. Automatically, the website provide you destination entities, ya, entities RA01 COVID-19 like the my presentation previous. Okay, COVID-19 virus identified. Okay, if not identified, RA01.1. Okay, and so on. Okay. The conclusion my presentation. The first, all member states of WHO are encouraged to follow their commitment to move on to ICD-11 documented with their approval of ICD-11 at the 72nd meeting of the World Health Assembly in 2019. Okay. The second, the ICD-11 ensures semantic interoperability and reusability of recorded data for the different use case beyond mere health statistics, including decision support, resource allocation, reimbursement, guidelines, and more. The third, the HIM profesional. Nah, mungkin di Indonesia, kalau kita menyebutnya adalah PMIK, teman-teman ya, partisipan semua. Jadi kalau di internasional, mungkin teman-teman akan ketemu dengan istilah the HIM profesional, ya. Atau di Indonesia dikenalnya dengan PMIK, ya, pereka medis dan informasi kesehatan. Should improve their knowledge and skill based on competencies for ICD-11. Ya, mau tidak mau, suka tidak suka, kita harus belajar tentang ICD 11. Oke, kapan di Indonesia digunakan? Nah, nanti kita tunggu. Maybe the government announce to use ICD 11. Okay, the last conclusion, the code of the ICD 11 are alphanumeric and cover the range from 1A00.00 to ZZ9 Z.ZZ. Okay, the references for my presentation, the ones you can access ICD WHO in international in English, okay. The second, WHO, okay, standard classification, you can access this link. The third, you can read the article about the ICD-11 background and method and so on. Okay, and the fourth, you can access this link to know about and use ICD-11. In this link, you can get the ICD-11 training. Okay, you can explore more and more. Okay, please you visit this link to know about ICD-11 more. Okay, thank you for your attention. Yeah.
Okay, thank you very much, Mrs. Haziza, for giving such a great presentation for the first part. We know that the 11th revision is more extensive and has greater implication for what can be done with the ICD than any revision since the 6th in 1948. All right, we will start the second presentation. Hello, Miss Nik Azriza. Hello.
Halo, Assalamualaikum.
Halo, Assalamualaikum. Good morning. Hello. Okay. Okay, we can hear your voice here. Miss Nik Azriza, we already read your profile at the beginning, so you can start your presentation now, and you have 30 minutes, please.
Yeah, thank you.
Okay.
Can someone assist me from...
Okay.
I need the assistant, thank you.
Okay, our team will help you. Oh, wait a minute.
Thank you, our moderator. Can you listen to my voice? Bisa dengar tak suaranya?
Ya,
bisa ya?
Bisa
Very
nih.
clear?
Oke.
Okay. Assalamualaikum warahmatullahi and salam sejahtera untuk teman-teman saya, terutamanya di Indonesia. Semoga sihat-sihat semuanya. Thank you to organizing committees, especially from Fakultas Kesihatan University of General Ahmad Yani, Unjani, Yogyakarta, for giving me the opportunity to share my knowledge with everyone here, especially in this third ISHIM. Okay, so let us look. My name is Nik Azizan Arifin. So I'm from UITM, University Technology Mara. As a senior lecturer in the College of Computing, Informatics and Media. So let us look at the outline for today's presentation. We're talking about the health information management. Next, please. So the outline for So this is the outline for today presentation. It's about introduction. It's about from the next is from IM, information management, to health information management. We look into the functional areas in HIM, and then development of health informatics management in Malaysia, the roles of HIM, professionals, the educational requirements, HIM education in Malaysia, and the last one, conclusion. Next. So HIM, or that is the shortest that we always pronounce it, health information management, has been around for decades. But what HIM encompasses today is just look like the field in the 1950s. Yeah? From paper-based medical records and manually filed to the development of electronic health records system. In today's digital landscape, health information has come a long way. Next. So let us look on the definition given by WHO. According to WHO, health information management is used in a broader term, right, to capture the various health information related activities and deliverables to support the strategic priority functions for assessing health, assessing health situation, coordinating the work of health actors, and identifying critical gaps in the response to ill health and building capacity for better health action. Next slide, please. So according to HIMA, right, okay, HIM is the practice acquiring, analyzing, and protecting digital and traditional medical information vital to providing quality patient care. It is a combination of business, science, and information technology. All right, so let us look on the next slide. Okay, before we are coming to health information management, right, the word, let us look about the word of information management here. So from information management to health information management, it is the application of IM practices to health and healthcare industry, defined as the practice of acquiring, recording, analyzing, storing, and protecting digital and traditional medical information, which are vital to providing quality patient care. So these, what we call the components of IM, we do have 4 components of information management, right? The first one is people, right? Policies and procedures, all right, and technology, and the last one is data and information. So let us look about the people. People, it doesn't matter how data intensive a business, people are always at the heart of an organization. So in this situation, we are in the organization of hospitals and healthcare industry. From the staff directly involved in IM through to the creators and users of information, and all information systems depend to an extent on human involvement as day-to-day operation. All right, yeah. So the next one is about policies and process. Yeah. So the policies and process define IM as integral, implementing an IM framework that will determine accessibility to information, storage procedures, and information security, along with timeframes for archiving or deleting data. So we need to have a well-defined and regularly reinforced a framework will help to drive information and records management, best practices in order to achieve strategic business outcomes. So the next one is about the technology. All right, it is an important role to become an obsolete to effective IM in organization. Yeah. Effective technology and line of business application will enable information discovery when required, and we need support the information sharing, integration, and analysis throughout the information cycle. All right, and the last one is about data and information. All right, is about that along with people, policies, and technology, all contribute to effective utilization of an organization intellectual property. Well-defined, We need to have the strategic information management objective that can have a direct and lasting impact on achieving business objective. Right? So looking at this, right, the HIM is responsible, right, for the accuracy, security, and privacy of patient records. As more and more hospitals are switching to electronic health records, right, and electronic health system, professionals in HIM also will be called upon to work with and protect this information. So we understand that HIM is a vital for every healthcare industry, healthcare organization, and all business that is associated, right? Not only in terms of legal requirements that must be adhered by to receive certain incentives and avoid penalties, but also we need to understand that the healthcare industry have an ethical responsibility to protect the personal health information in their possession. Okay, so on this, what we can say that the focus of HIM here allows that organization many positive benefits, such as the potential for increased efficiency and optimization for of healthcare information system access, and the key aspect involved with the revenue cycle management. Right. So next, please. So what we are looking here, okay, on health information management. Okay, this is totally about HIM. Right, looking at this particular slide, we can have a look. Okay, this is integration with EMR, the remote care with the telemedicine, right, the knowledge repository, okay, reporting, pharmaceutical. So they are integrating each other. So it will be what we can say a health records includes information with the patient histories, with the lab results, x-rays, clinical information, demographic information, and notes. Right, next please. Future, the importance of HIM, right, particularly at the beginning of the 21st century. These are the following reasons why we need the HIM. It's a progress in information processing and information and communication technology is changing in our societies right now. So the amount of health and medical knowledge is increasing at such phenomenal rate that we cannot hope to keep with it. Right, store, organize, retrieve existing and new knowledge in a timely fashion without using a new information processing methodology and information technologies. Next. Significant, all right, the significance of having HIM, right, we can have a look, is about to obtain from the use of information and communication technology to support medicine and healthcare. Okay, so let us look on this particular point of a relationship between HIM, HIT, and health informatics here. Okay, so talking about health informatics is in between HIM and HIT. So health informatics is the application of technology tools, right, and information system in healthcare setting or context, whereby HIM is concerned on the records, on the coding, on the documentation, right, on the policy, on the guidelines, on administration and compliance, whereby health IT technology, all right, it concerned about tools, computers, okay, hard work, right, software, networking, programming, data storage, and security, right. So these are the things that we need to know. Where are we, right? And so we are in the area of HIM, health information management. So health in hospitals, in the healthcare industry, we do have IT professionals and we do have information professionals. So we need to together, right, cooperate, okay, totally dependent each other for the success of a good administration in the healthcare in the hospital. So let us look the next slide, please. All right, so this is the functional areas in HIM. We do have about 5 points here: data capture, validation, and maintenance. Right, basically it's about the introduction of policies and procedures to get reliable data. Right, the result in fewer claims denials, decrease operational costs, improve patient safety, and better research outcomes. The stage involve activities related to data quality management, data integration support for healthcare, data standard, and of course, the optimum information flow design. So the next point is about data analysis, transformation, and decision support. So this is revolved around deriving the knowledge and insights critical for enhancing patient care. The third point is about information dissemination and liaison. So this is regarding effective sharing of health records, reports, and research findings. So the next point, health information resource management and innovation, taking care of health documents across the life cycle. And the last one is health information governance and stewardship. So ensure a compliance of data use with regulations, standards, ethical norms, and internal organizational policies. All right. Next slide, please. So let us look on development of health information management in Malaysia. All right. Okay. So let us the next slide, please. The evolution of HIM in Malaysia started from a basic statistical reporting. That will be the main how we start with the HIM. Through papers to an ICT-enabled health information management system. The building blocks. All right. The building blocks to facilitate the implementation of such systems are through the development of health informatics standards and a mechanism for adoption of such standards. So healthcare in Malaysia is provided by the public and private sectors and non-governmental organizations. So the major provider and financier of health services is the Ministry of Health. Basic health care through health facilities is currently available to and accessible to more than 95% of the population of Peninsular Malaysia and about 70% of the population in Sabah and Sarawak. So we do have the secondary and tertiary cancer services are now widely available in government hospitals and private hospitals across the country. So what we can have a look here, okay, in Malaysia, okay, we can see that, okay, it is not only in urban but also in rural areas. Yeah. So we do have about 146 hospitals, and currently is about 13% going is already in IT, and the rest still using manuals, halfly and halfly electronic, right? But we are right now ongoing to electronic health records. Yeah? Okay, next point, please. Okay, so this is about the next point, please. Okay, so we do have my HDW, a Malaysian Health Data Warehouse, right? A trusted source of truth, of comprehensive healthcare data, structured for query and analysis purposes, right? The objective, reduce workload to human resources, optimize for analyzing and reporting, multi-dimensional, web-based, built on one to use many. So the benefits of having this one, effective management, security, privacy, integrated, comprehensive, and overarching system governance. So the next one, we do have about MyHarmony. All right, it's intended to harmonize data by codifying textual data with SNOMED City codes, right, and to perform semantic-based query over the SNOMED City codified data, right? Yeah. So in Malaysia, we are still using ICD-10. Soon, we also will be using ICD-11, inshallah, right? Yeah. So the next one, we look on the common career path in health information management. Yeah. So looking at these, okay, we are looking on HIM, and of course, on the thing that we need to look in HIM is about the medical records, yeah, the coding, right, and CDI, education, yeah, and then data management analysis, the information system, right. So these are the career path, right, whereby all students in health information management, you are really need to focus on this particular subject. Okay, next. All right, so these are the examples of traditional careers and in HIM, right. Previously, we are practicing this one. The acute care inpatient hospital, we have the physician practice, right? We have the coder, we have the medical records analyst, right? And consultant, education, of course, yeah? Skilled care facilities, including nursing, long-term care, rehab centers, and of course, the last one, information systems. is about EHR analyst, all right, business application developer, all right, yeah. So the next point, next slide, please. Next slide, please. Okay, so we are HIM is valuable and expanding. So the future of HIM, all right. So we need to understand that, okay, the carriers in the budding carriers in HIM, right? It is not only talking about medical records, but we need to the expanded role of the information professional in health information management. Yeah, so we are looking on the health informaticists. We are looking on electronic health records builder. Okay, the education, we need to have more health informatics professor here. Right, information system is about business system administrators. Okay, and revenue cycle as well. Right, next point, please. All right. However, what we can say that we do have shifts in the focus of HIM, whereby there are some skills are sunsetting, right? Yeah, where there are some skills that we need to gain more knowledge on that. Yeah? So, for example, what are the skills that are sunsetting? The paper, medical records knowledge and management, all right? Yeah? So the paper handling and archiving, checking for data manually, all right, okay, data and signature reviews, for example, right? So presence of dictation, all right, detection and transcription. So these are everything what we can say that skills that are sunsetting. However, there are skills that we need to learn more and more, right? And the knowledge of electronic data management and use, understanding of physician workflows, right? The lean process, design and process improvement, data integrity and electronic data retrieval, for example, and the clinical classification system, the ICD, right? For example, like just now, our speaker previously, Dr. Hosiza, right, talking about ICD-11. We need to learn about that, all right? That is something new, right? Before this, we are using ICD-10, so we need to transform ourselves and know more, explore more about the ICD-11 and CPT, SNOMED, all right, electronic health records design and optimization, and the last one, clinical documentation. All right, next, please. So these are what we call the health information professionals. What do HIM professionals do? They are working as a critical link. I repeat the words of critical link, all right, between doctors, insurance providers, patients, healthcare professionals. They manage health information in a way that is consistent with the medical, administrative, ethical, and legal requirements of today's sensitive environment for protecting health information. So basically, this is what we call, all right, we do have IT professional, we do have information professional, but sometimes once you want to transform to what we call the digital environment, we always forgot with the role of health information professionals. All right, the success of EMR, the success of each EHR in each hospital, we need to have these two professionals totally dependent. All right, also we need to get input, all right, with the cooperation, full cooperation from the healthcare professionals, IT professionals, health information professional, as well as healthcare professionals. They are really working together, right, for the success of what we call EHR or EMR in the hospitals. Okay, so next point, please. Okay. So HIM professionals are experts in managing patient health information, medical records, administering computer information system. All right, the words of administer. You are not, as IT professional. We just administer computer information. At least we know about the system, right? Encoding the diagnosis and procedures for healthcare services provided to patients. So they are protecting privacies and work to keep confidential information secure, responsible for safeguarding the most confidential patient data, including medical histories, the lab tests, reports, diagnosis, the treatment plans, insurance information, medication, and the notes of doctors and nurses. Right. The next point, please. So these HIM professionals are highly trained in letters, information management technology application and understand the workflow in any healthcare provider organization, from large hospital system to the private physician practice. So they need to know, because of what? They serve in bridge roles. Okay, connecting clinical, operational, and administrative functions. So that is the most important thing. Yeah? So we need to moving forward on this, right? Something that we can say that we are the core person, the asset in the hospital, right? Because we are serving as a connecting roles between the healthcare professionals, between the IT professionals. All right, next please. Okay, next. So let us look the roles of HIM professionals. We do have 3 categories here, right? In health, in information, and in management. Of course, in health, we are looking on analyze and code clinical data, collect data to support research and required reporting, use clinical data to support financial decision, right? And use clinical data to support whatever decision, especially among the healthcare professionals. Yeah? Okay, information, storage of patient in defined format. So reports of aggregate patient data, right? Maintenance of data dictionaries according to standards. Yeah? And then management, what we can look here, development of policies and procedures for use, maintenance and destruction of health records, manage the HIM functional areas, the coding, abstracting, release of information, and of course, the last one in terms of management, either he or she is a chair of participation in hospital committees. Right, next please. All right, so this is the major responsibility of HIM professionals. Right, we do have 3 points here: the quality of patient's health information. They need to know, they need to look on the integrity of patient health information, and the last one, protection of patient health information. So once we talk about the quality, we need to know the certain points that falls under quality. It's about the accuracy, it's about the completeness, it's about the neatness, it's about timeliness. Whereby the integrity, we are looking on the confidentiality, the dignity, and the protection is more toward the safety and security. All right, and next point, please. All right, so this is the current areas of specialty, right? So we need to know, we need to learn more about this, yeah? With the current application of IT in health information management, HIM professionals who want to remain relevant in the professions must have to acquire the right education and skills. So these are the current areas of specialty. We do have health data analytics, electronic coding, right? Electronic health records, health informatics, quality control, right? And so the demand for more data means HIM professionals will need to be capable of controlling big data and ensuring its security. Yeah? So experts said that HIM's unique combination, okay? HIM's unique combination of clinical, slide please. All right, IT skills, we can look at point here, makes them ideal leaders in the emerging data. So please everyone, so we need to relevant in these professions. We are on the right track right now, but we need to learn more and more and update more to more information about something that relates with the health information management. All right, so we need to be the ideal leaders for emerging data, inshallah, right? Yeah? So the next point is, next slide, please. Okay, on this part, we look on the health information management education in Malaysia, right? So health information is growing and big data means changes the roles of HIM management professionals. So on this part, what we can say that we do have a lot of things that we need to look, the health knowledge, the technical skills, for example, right? So these are the knowledge that we need to currently focus on. So let us look the next point. Okay. So in educational requirements, we do have three things that we are really need, all right, in order to be a very what we call say that HIM professionals. Okay, we do have the academic skills and HIT, right? On the academic part, we understand that, okay, we need to know about the health knowledge, should be familiar with ICD-10, all right, knowledge is critical in medical coding, as well as understood the medical terminologies, diagnostic methods, processes for disease and injuries, and more. Having a CPR and basic first aid training is also an asset for that. Yeah. So how about the skill? The skill is basically numerous applications that will be important to the job. Yeah. So we need to know about skills, for example, those that related to the IT software. Yeah. Then the staff need to know the technical infrastructure, the framework, and sites of managing health information. They may have background that are more focused on IT and providing support for EMR, for example, or EHR, right? Yeah. So next point, please. So this is basically what we call the distribution of health information management education in Malaysia. Right. So in Malaysia, we do have some universities that providing professional courses, right, from diploma to the postgraduate. Yeah. So we do have diploma in HIP, all right, degree and postgraduate as well. Okay, next please. So this is the among the subjects that has been taught, right? It's about ICD, it's about human anatomy and physiology, the medical terminology, coding, right? Case mix. Case mix is also is a part of main concern in the Ministry of Health in Malaysia, right? Medical records management, electronic health record system, and health economy. Yeah. All right. So next point, please. So among the subjects for the postgraduate, so these are the things that we need to learn during the postgraduate, right? So next point, next slide, please. Okay. So this is very important, all right? Okay, in order to provide a good education, so we need to go to with the Malaysian Qualification Agency, we call as MQA. So the main role of MQA is to implement the Malaysian Qualification Framework (MQF) as the basis for quality assurance for higher education, as the reference point for the criteria and standard for national qualifications. Yeah. So they are responsible for monitoring and overseeing the quality of assurance practices and accreditation of national higher education. All right. Yeah. So next. On this part, okay, we do have in my faculty right now, all right, so we already just changed, merging with others faculties. So we are under the College of Computing, Informatics and Media. All right, yeah. So next, so these are the courseworks for our programs, okay, from the diploma to degree, right, and postgraduate. Yeah, all right. So we do the next point. We also do have about a doctor in philosophy, right, in information management, and we also have a few persons, all right, lecturers that are focus, right, specialization, majoring on the health informatics. Yeah. All right. So the next, the conclusion, right, we can say that the future of medical record services right now, right, it's very wide. It's not only medical records, it's more towards health information management. Medical records are a part of it. All right, we need to rebrand and expanding the role of medical records. So what we are doing right now, okay, we need to learn more because right now we are in the IT era, right? A lot of things that we need to learn, right, for the time being. All right, as well in Malaysia, we are still practicing the manual because only 13% of hospitals that use IT, but the rest are using manually. So right now, the thing that we are really concerned is about the transformation of manual to EMR. So we need to know about that. That's why not only focus to medical record, but in a big scope of health information management. Right, next point, please. So HIM, a set of practices, right, to organize medical data that can be effectively and used for enhance the quality of care, right? So past 85 years back, right, the HIM profession has been in the pivotal role, right, of highlighting the importance of clinical documentation integrity and compliance, whether the information at the index card, okay, on paper medical records, dictation and transcription, hybrid or electronic patient records. All right, I do admit that we are still applying this one, but so far, all right, right now we are moving forwards, right, moving forwards in order to big concept, right, we are looking on HIMS, whereby we need to ensure everything will be in electronic soon. Okay. However, certain things that we need to know whilst talking about the electronic is about the to ensure the patient information privacy and security. All right. So next one. So the current and future HIM professionals should aim to lead the healthcare industry into the next generation of health informatics and data analytics. Yeah? So this professional, all right, where are we right now in this particular seminar, all right? Yeah? So we need to know that where are we, right? We are on the right track, okay? We have a variety of settings, okay? Either in hospitals, in clinics, in private practices, but they help to connect team members from clinical administration and from various departments in the hospital, right? Okay, in order to have a proper management of protected health information, right? With that, thank you so much. This is my references. Next. All right. Okay.
Thank you, Mrs. Nick Aziza. That's wonderful.
Thank you so much.
Presentation. Okay, as we know, become health information managers had a lot to do such organize, oversee, and protect patient health information data, which includes some symptoms, diagnose, medical histories, death result, and procedures. Okay, ladies and gentlemen, now we've come to the discussion session 1. We are glad to receive so many questions here. And for the first, we are going to select 3 most voted questions for our speakers. Okay, please team, bring the slide on screen.
Mariam.
Okay. Okay, wait a second. Okay, please team, we will see the question. Okay. The first question is addressed to Mrs. Hoziza and Mrs. Nick. What is the challenge of the implementation the ICD-11 in Indonesia and Malaysia compared to the previous version? It's from Aulia. And
sorry, I can't hear you actually. Quite the voice is a little bit slow here.
Oh, okay. We will repeat. The first question is addressed to Mrs. Hoziza and Mrs. Nick. What is the challenge of the implementation the ICD-11 in Indonesia and Malaysia compared to the previous version? This is this question from Aulia. Okay, maybe Mrs. Nick first. You can answer.
All right. Talking about maybe the ICD 10 and 11, I think I give it to Dr. Aziza to proceed with that. Okay. About the challenges, is it moderator?
Yes, Nick, maybe the challenges the challenges to using ICD-11 in Malaysia, in Indonesia. Maybe the question is it.
Okay. That one clear. Thank you, Dr. Aziza. All right. Okay. So talking about the challenges right now. So we are still implement ICD-10 in Malaysia. All right. Yeah. So soon, what we can see here right now. Okay. 11 ICD-11 soon, but we do not know. We are still using. In fact, from time to time, in ICD-10 as well, they need to, especially the medical records coder, right? We call medical records coder in Malaysia. We do have the medical record officer, and we do have also coders. So they need to learn a lot actually about that. Okay, as mentioned just now, one of those things that important as HIM professional is about the coding. Yeah? So in Malaysia, we do have the Ministry of Health always do courses, right, for those staffs, right, and of course, in fact, me as well as academician, although not in what we call in the hospitals environment, but we need to learn because we need to teach the students, right? So we need to update with all current information, okay? And of course, the challenges, what we can see that right now, in order to know the sum of important information, coding itself, we can see that as one of the what we call just now slide given by Dr. Aziza, right? A little bit different on that. Yeah? So for me personally, I said that I am not expert in ICD-11. All right, okay. So my humble apology on that. Okay, so I need to learn. That's why in fact, I want to ask Dr. Aziza as well the differences, the main differences of ICD-10 and 11. Okay, I'm good in 10, but ICD-11, I need to know more, right? For the time being, there is no courses on ICD-11 in Malaysia, right? They are still on the planning part. So maybe on that, I think I just pass it back to Dr. Aziza. Maybe she can answer on that. So she is more expert on the coding. So you are the floor is yours, Doctor.
Okay. Okay, thank you, Mrs. Nick. Okay, and the next, Ms. Aziza, maybe you can answer the question.
Yeah,
the same question.
Thank you, Miss Moderator, Miss Diana. Maybe the challenges to apply the ICD-11 in Indonesia, maybe the regulation ICD-11 not released until now. Okay. Yeah. In Indonesia, in the process transformation, maybe the digital, ICD-11 is digital version. Yeah, it's difficult to move to ICD-10 to ICD-11. Maybe the infrastructure is expensive to implement ICD-11. Okay, because in mostly hospital in Indonesia, hospital and healthcare in Indonesia is still paper-based or medical record in paper-based. Okay, it's not easy to move to apply ICD-11. Okay, yeah. I think maybe we have too much time to prepare, implement the ICD-11 for case mix in Indonesia. Okay, yeah. beside the infrastructure not ready or not yeah, maybe the infrastructure not ready until now maybe. Nah, beside maybe the role of the government policy must to cooperate and healthcare community to implement the ICD-11 as well. Okay, yeah. Maybe the challenges in Indonesia, we can tell about it, Miss Christiana, Miss Moderator.
And the next question comes from Ayu. This question addressed to Mrs. Hoziza.
Okay.
What is different of ICD-10 and ICD-11? And what is the essential thing that medical record staff have to know to implement ICD-11?
Okay. The major difference of ICD-10 and ICD-11 may be in the using the digital version. Okay. Maybe the expansion of the ICD-11 add the API so the integrated and the other application. Okay. But the hospital and healthcare must be in digital or electronic environment to implement ICD-11. Okay. How about the medical staff? Okay. You can maybe the PERMIKI give a training to know about ICD-11, or you can visit the website ICD-11 to explore about the ICD-11 more. Okay, PERMIKI and education institution or APTIRMIKI here must responsibility to improve the knowledge about ICD-11. Yeah. The next, the curriculum in medical record and health information education must to add the curriculum and material in studying it ICD-11. So the student must learn about the ICD-11 in class, in lab maybe. Okay. Thank you, Miss Ayu. I hope you clear about your question.
Okay, thank you. And we still have a question here. And the third question is, okay. This is from Agnia. This question addressed to Ms. Hoziza. What is the difference between using ICD-10 and ICD-11? Okay.
Okay. Thank you again, Hina. Okay. All right. Maybe I can just answer the implementation of EMR. All right. Yeah. So currently we are still using ICD-10. All right. Okay. Soon. Okay. We just started probably at the end of 2024. This is the on the strategy part of Ministry of Health, right? We want to start the training, but we just want to proceed with the training. Okay, so this is a part of Ministry of Health, in fact from the teaching hospital as well. Okay, so for the time being we are still using ICD-10. All right, so the difference between ICD-10 and 11, I think just now Dr. Aziza already mentioned about that. So come back with the question, how the implementation of EMR in Malaysia. Right, on this part, in Malaysia we do have about 146 hospitals and 13% is using IT, right? So we do have in Malaysia a few hospitals that is what we call using this total hospital information system, right? Yeah? So a certain hospital using IHIS is about intermediate health information system, and the last one BHIS, basic hospital information system, right? Yeah? So this system that has been implemented in the hospital, it means that the hospital is fully utilized electronically, right, from the beginning, okay, from the patient coming to the hospital till the end of the process. You are seeing the doctor, all right, get the consultation from the doctors, and last, all right, you are discharged from the hospital. So all the process, everything. Instead, if the patient warded as well, okay, outpatient, inpatient, everything in electronic, all right. So this is what we call these, yeah, okay. So example of hospital that using these in Malaysia, like Hospital Putrajaya, Hospital Serdang, okay, Hospital Selayang is the first hospital, right, and then Hospital Sultan Ismail. So these are the hospitals that totally using IT hospital, and those hospital, the new emerging hospital, also we are applying this, right? Yeah? So how about IHIS? IHIS is being partly, okay, there are certain departments that apply system and still still using manual. It means that, okay, we are still using the paper records, the medical records, whereby that it will be the communication, the main communication between doctors and the patient. So we will still using that one, right? So that will be the intermediate hospital information system. We are still not integrated the system in the hospital, right? Yeah. Whereby basic hospital information system is only a few. For example, like registration that we are going on electronic, all right? And another one, we can look on the lab information, lab department, okay? Radiology department, for example. So only a few, only a basic department that already go for the system. The rest are still using. Right, if the patient admitted to the ward, for example, you're still using the medical records. The doctor will take a note, all right, will give the clinical notes, all right, and keep it. After that, they will keep it. Okay, the nurses will keep it, all the notes in the medical record folder, all right, and of course, we do have storage in order to keep those paper records. So that will be the scenario right now in Malaysia. So we are right now going, right, and the first right now, inshallah, end of this year, okay, one hospital manual, I mean that totally manual, will be transformed to electronic. So that is another situation whereby very really different with this hospital where in which that the hospital is being the new hospital built up with the IT and everything in electronic. So right now is a very what we can say question mark to us, and what's next, what next, all right, we want to know, all right, what are the problems, especially transformation from manual to electronic, right? Inshallah, the pilot study will be one of the hospital, government hospital in Negeri Sembilan, all right, will be the pilot study on transforming from manual to electronic. All right, I think that's all from me. Thank you.
Thank you so much, Mrs. Aziza. Sorry for the inconvenience because I misread the question here. Okay, the next question. Okay, Tim, can you bring the slide here for the fourth question? Okay, wait a minute. Okay, this question comes from Via, addressed to Mrs. Hoziza. Has the use of ICD-11 been spread evenly in various countries? Okay, Ms. Hoziza, you can answer now.
Okay, thank you, Miss Fia. The good question. The countries, the various countries maybe still preparing to implement ICD 11. Yeah. Example in USA, until now, using the ICD 10 CM clinical modification, yeah, for diagnosis and procedures, yeah. Is it not easy to implement ICD 11? Okay, yeah. Some of the countries preparing for using ICD 11 to modification according to the need of the countries, each countries. Okay, now, maybe the same in Indonesia. Yeah, maybe in 2 years or 3 years next we will implement ICD 11. Okay, so no countries until now implement ICD 11 smoothly. Okay, in preparing. Thank you, Miss Wia. Yes, Miss Moderator.
Okay, thank you to Mrs. Hasiza and Mrs. Nick. Yes, that's a very detailed answer to the question. We hope that our participants understood with the answer and bring knowledge advance. And a great appreciation is addressed to the two speakers for the inspiring presentation. And now, ladies and gentlemen, before we go to the second session, we will have a short refreshment for about 10 minutes. Okay. And we make sure to keep stay in this link. Thank you.
Bikin cetar harimu dengan Red A. Kapanpun, dimanapun, Red A, ready to win your day. Win your day with Red A. Hai Besti, mau tahu perawatan Simple Go ala Red A Kosmetik? Yes, yang pertama kamu harus tahu kenapa sih pembersihan itu penting. Gak mau kan wajah mudamu tampak tua? Atau jerawat dipupuk hingga subur, hingga berlobang mungkin? Nah, ini salah satu manfaatnya agar wajahmu terawat sedari muda. Sebagai investasi kulit tetap awet muda. Yuk, langkah awal kenali jenis kulitmu. Yang pertama, kulit normal. Kulitnya terasa lembut, kenyal, segar, lembab, pori-porinya tidak membesar dan hampir tidak ada keluhan jerawat. Yang kedua adalah kulit kering. Kulitnya terasa kering, tidak kenyal, kasar, dan tanpa kusam. Pori-porinya hampir tidak kelihatan dan cenderung mengalami tanda-tanda penuaan dini atau biasa kita sebut dengan keriput. Yang ketiga adalah kulit berminyak. Kulitnya terasa tebal, berminyak, tampak mengkilap, pori-porinya cenderung besar dan sering memiliki problem jerawat. Dan yang terakhir adalah kulit kombinasi, di mana pada bagian T yaitu dahi, hidung, dan dagu berminyak atau tampak mengkilap, sedangkan area pipi normal atau kering. Yang mana nih jenis kulitmu? Next, ketahui permasalahan kulitmu, berjerawat atau tidak berjerawat. Jika berjerawat, kamu harus ekstra hati-hati karena jerawat ini bisa timbul karena hormon, kebersihan sekitar seperti area rambut, poni, bantal, kasur, dan seringnya memegang wajah dengan tangan kotor. Ini adalah pemicu jerawat. Satu lagi nih, kalau berjerawat jangan sekali-kali dipencet ya, biar nggak berlubang seperti hatiku. Yuk langsung ketahui caranya. Langkah awal, lakukan pembersihan dengan Red A Cleansing Milk. Red A Cleansing Milk ini berfungsi untuk mengangkat debu, kotoran, minyak yang pastinya bisa menyumbat pori-pori. kedua, gunakan Red E Face Tonic. Red E Face Tonic ini berfungsi untuk mengangkat sisa-sisa cleanser, mengembalikan pH kulit, dan menjaga kesegaran kulit kita. Jika kamu merasa kurang bersih sambil mandi, boleh gunakan facial foam. Tentunya sesuaikan juga dengan jenis kulit kalian ya. Jangan lupa akhiri dengan menggunakan face tonic supaya pH kulitmu kembali normal. Berikan nutrisi dan lindungi kulit wajahmu dengan Red E Moisturizer. Selain melembabkan, juga sudah mengandung UV filter. Pastikan gunakan Red E Moisturizer karena ini adalah salah satu perawatan yang sangat amat penting untuk menghindari flek hitam di wajah. Nggak mau kan wajahnya bertotol-totol masih muda? Eits, jangan lupa ya, untuk kalian yang berjerawat, kasih nih Red E Acne Cream, biar jerawatnya kempes dan kering. Untuk tampilan fresh sehari-hari sebelum berangkat sekolah, jangan lupa Red E Loose Powder. Red E Lip Glow Color Balm menggabungkan fungsi lip balm, lipstick, dan lip gloss. Untuk sehari-hari, aku pakai warna Sparkling Rose nomor 500. Nah, untuk jalan-jalan, aku suka warna yang ini nih, 504 Purple Punch. Miliki semuanya ya, 6 warna. Untuk tubuhku, aku gunakan Red E Beauty Lotion Whitening agar lembab dan melindungiku dari sinar UV. Simpel kan? Lakukan perawatan ini setelah pulang sekolah juga ya. See you next time, Bestie, di tips berikutnya.
Nur, cek. Nur, kamu pakai apa sih?
Pasti Kaliza salvo kan sama warna bibir aku?
Iya, salvo banget tahu. Coba bisa di-spill nggak sih?
Jadi nih aku kasih tahu ya Kak. Jadi tuh aku tuh pakai lip glow color balm. Ini tuh produk dari Red E.
Oke.
Ini tuh warnanya tuh tahan lama loh Kak. Tadi tuh aku pakai dari awal sebelum acara hingga saat ini tuh warnanya nggak hilang. Jadi kayak tahan lama gitu. Nah, yang aku pakai ini nomor 502. Jadi kayak warnanya memang pas gitu Kak.
Oh iya, emang kelihatan banget sih. Aku tuh dari tadi tuh liatin kamu tuh pakai gituan tuh, aku tuh penasaran gitu loh, pengen di-spill produknya. Oke, udah di-spill ya, ternyata produk dari Red E Cosmetic yang lip color balmnya.
Iya.
Jadi
tapi untuk selanjutnya nih Kak, Kaliza pasti lupa ya buat peserta-peserta kita nih.
Bener banget, kelupaan ya kita sama peserta kita. Halo semuanya. Semoga kabar kita semua baik-baik ya.
Dan tetap semangat tentunya ya.
Iya, bener banget. Oke. Kira-kira aku bisa dapetin produknya di mana sih Kak?
Gampang sekali Kaliza. Nah Kaliza tuh apalagi sekarang musim hujan ya, pasti males tuh kayak kita tuh pergi jauh ke tempat toko kosmetik yang tempatnya sangat jauh ya.
Bener banget.
Namun sekarang nih Kaliza, toko kosmetik terdekat itu sudah menyediakan produk ini.
Oh wow.
Dan bukan cuma lipstick aja nih Kak yang disediakan, namun
ada apa tuh?
Macam-macam Kak. Mulai dari
ada apa aja?
Hand body dan juga bedak badannya nih Kak.
Ternyata nggak cuma perawatan bibir aja ya, tapi ada perawatan badannya, ada perawatan mukanya juga. Wah, impresif banget ya, menarik.
Untuk hand body-nya tuh Kak, dia tuh warnanya aromanya maksud saya itu tuh sangat wangi dan juga tahan lama baunya Kak. Boleh dicium gak sih? Boleh dong. Kaliza mau coba nggak nih? Gimana tuh Kak wanginya?
Bener banget teman-teman, bener banget ya. Bener banget. Oke.
Nah untuk lipstiknya Kaliza mau coba nggak?
Mau banget dong, mau cobain dong.
Kita cobanya di belakang ya.
Oke, sebelum itu teman-teman semua itu nggak perlu khawatir karena kita juga menyediakan door prize buat teman-teman semua yang bisa kalian dapetin secara gratis dan cuma-cuma. Jadi gimana Kak dapetinnya?
Intinya untuk para peserta tetap standby di depan Zoom-nya dari awal acara hingga acara kita selesai.
Tuh teman-teman dengerin ya, jadi harus standby, dengerin materi-materi dari pembicara dan juga harus standby sampai akhir karena door prize ini bakal ada di akhir acara.
Ya,
jadi kalian semua bisa dapetin produknya dan cobain secara gratis. Oke Kak, mau cobain dong? Yuk ke belakang panggung.
Universitas Jenderal Ahmad Yani Yogyakarta merupakan lembaga pendidikan di bawah Yayasan KTK Ekapaksi TNI Angkatan Darat, terbentuk dari penggabungan Stekas dan Stemik Jenderal Ahmad Yani Yogyakarta. Universitas Jenderal Ahmad Yani Yogyakarta bersesanti Aditya Mahatma Daksa yang bermakna senantiasa menghasilkan lulusan yang pandai dan bijaksana, berjiwa besar, cakap dan ahli.
Sebagai bagian Universitas Jenderal Ahmad Yani Yogyakarta yang dimiliki oleh TNI Angkatan Darat dan membawa nama besar Jenderal Ahmad Yani, Fakultas Teknik dan Teknologi Informasi diproyeksikan menghasilkan lulusan wirausahawan teknologi di era ekonomi digital yang bukan hanya unggul secara akademik, namun juga berkarakter dan memiliki jiwa nasionalisme. Ditunjang dengan fasilitas yang lengkap sesuai dengan kemajuan teknologi, kurikulum yang selalu up to date, dan dosen pengampu yang berkualitas, Fakultas Teknik dan Teknologi Informasi Universitas Jenderal Ahmad Yani Yogyakarta berkomitmen mempersiapkan para Ahmad Yani muda di era ekonomi digital. Saat ini menyelenggarakan 4 program studi, yaitu Prodi Sistem Informasi S1, Prodi Informatika S1, Prodi Teknologi Informasi S1, dan Prodi Teknik Industri S1.
Fakultas Kesehatan Universitas Jenderal Ahmad Yani Yogyakarta saat ini menyelenggarakan 8 program studi, yakni program studi pendidikan profesi nurse, prodi pendidikan prosesi bidan, prodi keperawatan S1, prodi kebidanan S1, prodi farmasi S1, prodi kebidanan D3, prodi rekam medis dan informasi kesehatan D3, serta prodi teknologi bank darah D3. Ditunjang dengan fasilitas yang lengkap dan terstandar sesuai dengan kompetensi keahlian, serta semua prodi telah terakreditasi oleh LAMPTKES. Fakultas Kesehatan Universitas Jenderal Ahmad Yani Yogyakarta siap mendidik dan mempersiapkan para Ahmad Yani muda di bidang kesehatan sebagai generasi penerus kejayaan bangsa Indonesia.
Fakultas Ekonomi dan Sosial Universitas Jenderal Ahmad Yani Yogyakarta saat ini menyelenggarakan 4 program studi, yakni program studi Manajemen S1, program studi Akuntansi S1, program studi Hukum S1, dan program studi Psikologi S1, yang kesemuanya diarahkan untuk menjawab tuntutan perkembangan era ekonomi digital.
Banyak kelebihan yang ada di kampus ini. Dari sistem pembelajaran, metode yang digunakan yaitu student center learning, yang mana mahasiswa dituntut aktif dalam proses pembelajaran. Dosen-dosen yang ada di sini merupakan dosen pilihan dan lulusan-lulusan terbaik. Fasilitas yang ada di sini tidak kalah dengan fasilitas yang ada di kampus lain. Saya bangga kuliah di Universitas Jenderal Ahmad Yani Yogyakarta. Salam mahasiswa.
Sebuah kebanggaan bagi kami dapat mendidik dan mempersiapkan para Ahmad Yani muda sebagai generasi penerus kejayaan bangsa Indonesia.
Halo teman-teman, kenalkan saya Ayu Kami, Ketua HIMARMIKA 2022. Hai semuanya, perkenalkan aku Aulia, Ketua Pelaksana ISHIM tahun 2022.
Halo, kenalkan nama saya Dwi Juliani. Saya sebagai sekretaris 1 di
Halo, nama saya Najma dari Bendahara 1.
Hai, saya Ulia Novianti.
bekerja sangat menantang, tapi nggak apa-apa. Itu merupakan suatu kebanggaan buat aku. Pesan aku buat ISHIM selanjutnya, semoga terbebas dari kendala dan berjalan dengan lancar.
Saya sangat mengesankan, bisa menambah wawasan baru, pengalaman baru sebagai panitia, kemudian bisa menambah pembelajaran untuk manajemen waktu dari bagi tugas antara jobbek ISHIM dan juga tugas kuliah. Capek tapi tetap dijalani, seru juga. Pesan saya semoga ISHIM kedepannya untuk tahun depan lebih baik lagi.
Buat acara ini the best banget, mantap. Tapi menguras tenaga tapi the best lah.
Capek sih, tapi ya seru juga karena tentunya anggota-anggota saya itu luar biasa. Terima kasih tentunya untuk semua anggota yang sudah bekerja sama dengan baik.
Media ini terasa sangat menyenangkan dan juga menambah pengalaman baru bagi saya. Terus semangat ke depannya.
Cukup melelahkan tapi seneng. Pesan saya untuk tahun depan semoga lebih baik lagi. Lumayan pusing ya, tapi asyik banget kok. Untuk lumayan pusingnya itu karena harus menggembok anggota yang lain itu biar untuk apa ya lebih aktif lagi, lebih untuk grup lagi. Buat ISHIM tahun depan semoga semakin baik ya, semakin sukses dan jaya. Harapan saya ya untuk ISHIM tahun depan semoga lebih baik lagi, dan untuk anggota si antar sendiri lebih aktif lagi, karena kan ISHIM ini event kita yang paling utama, jadi harus benar-benar matang persiapannya.
Okay, ladies and gentlemen, we hope that you have a nice break. And now we will start the second session. Mr. Zacharias is joining with us now. And I'm glad to see you here, Mr. Zacharias. And before Mrs. Zacharias give his presentation, I will inform you. For all participants can ask question. You can ask your question during session. You can type your question in the chat box. And for those who have raised their hand to open the microphone, I will invite you at discussion session, and don't forget mention to whom your question is addressed. Okay, I will read your profile first, Mr. Zacharias. He is a lecturer and currently head of at Medical Record and Health Information Unjaya. He graduated from Gajah Mada University as Master of Public Health. He also had a lot of experience as a practitioner. His latest intellectual property rights patent is standard operational procedures for digitizing Mr. MR documents using scanner tool at Waters Hospital. I'm sorry. Okay, Mr. Zacharias, you have 30 minutes to presentation. Okay, please.
Thank you very much. Thank you very much to Mrs. Arin. All participants, ladies and gentlemen, Assalamualaikum warahmatullahi wabarakatuh. Thank you for your participation. And for Mrs. Ngatoyatu Rahmani, MNS, as first Vice Dean Faculty of Health Unjani Yogyakarta, for wonderful opening remarks on this seminar. The honorable speakers from within the country and abroad, honorable all distinguished guest presents and participants, we are glad and pleased to welcome you. Let me also extend a warmest welcome to the seminar by HIMARMIKA, Student Association of Medical Record Health Information Department, Faculty of Health, Jenderal Ahmad Yani University, Yogyakarta, Indonesia. May I share screen? No. Maybe I need help from IT staff to share my PowerPoint presentation.
Sorry for inconvenience. Please to all participants, wait a minute. Our technician will fix it.
Okay, ladies and gentlemen, I'm sorry for this little inconvenience on behalf of the committee. And now I will present my presentation today, efforts of the medical record program to improve the learning process that is responsive to the progress of health information management. In the Indonesian context, higher education institution in compiling and developing the curriculum must refer to national standards. The challenge faced by higher education institution in curriculum development in the era of the Industrial Revolution 4.0 is to produce graduates who have new literacy skills, namely data literacy, technological literacy, and human literacy with noble character based on religious beliefs. Higher education institutions need to reorient curriculum development that is able to answer these challenges. There are 3 new literacy skills. Maybe some of you have familiar about the 3 points. Firstly, data literacy is the understanding to read, analyze, use data and information, in this case big data, in the digital world. Point 2, technological literacy is understanding how machine work and technology application, in this case, coding, artificial intelligence, and engineering principles. The last is human literacy, is an understanding of humanity, communication, and design. We need preparation. So, preparation of more innovative learning system in higher education, such as adjusting learning curricula and improving student abilities in terms of data information technology or IT, operational technology or OT, Internet of Things or IoT, and big data analytic, integrating physical, digital objects and people to produce competitive and skilled university graduates, especially in the aspects of data literacy, technological literacy, and human literacy. General education, industrial revolution 4.0 competency. We can see this schema. There are 5 circles that describe about human literacy as a part of general education that must be mastered by students. Data literacy and technology can be applied in elective courses. And we know that a critical, systemic, lateral, and high-level thinking entrepreneurship is requirement. Data literacy, technology literacy, and human literacy. We can see the first wheel, general education, cognitive ability, co and extracurricular activity, lifelong learning, and new literation. How about students and graduates of medical records and health information? Ability to read, analyze, and use information, in this case big data, in the era of the digital world machine learning. Watch, buy, and love. Understand how machines work and the application of technology applications, coding, artificial intelligence, and engineering, principles, and cybersecurity. Understanding aspects of humanities, communication design, entrepreneurship, and creativity. Understanding aspect of humanities, communication design, entrepreneurship, and creativity. Skills through leadership techniques and ready to work in a team or teamwork. Cultural agility and cultural agility understand that all diverse students with various backgrounds are able to work in different environments at home or abroad. Entrepreneurs, including the spirit of social entrepreneurship. This is a basic capacity that all students should have. Here the reference for medical record study program and health information management. Okay, you can get more information at this address. I'm sorry. And here we can see the schema of the health information profession and IT domain. There are HIM, health information management, that focus on the acquisition, analysis, and protection of health information necessary for improving healthcare quality, safety, privacy, and efficiency. Often serves a bridge connecting clinical, operational, and administrative functions within the healthcare system. Secondly, HI, or health informatics, focuses on information systems and technology as applied to the continuum of healthcare delivery. Interdisciplinary field which participates in the design, development, adoption, research, analysis, and application of information technology based innovation in healthcare delivery, management, and planning. HICT, Health Information and Communication Technologies, focuses on the technological aspect of managing health information and system, working with software and hardware used to manage and store patient data. Use infrastructure technology and tools to develop, manage, and secure health information and exchange health information in a digital format. IG, or information governance, focuses on information as a strategic asset that requires high-level oversight. At formal IG principles, you can see in the schema with accountability, transparency, integrity, protection, compliance, availability, retention, and disposition. Now we talk about health information management itself, or HIM. It's the practice of obtaining, analyzing digital protection and traditional medical information that is vital in providing quality health services and maintaining daily activity records of health information management and electronic health records, act as liaison between clinical functions, operational and administrative activities. Health information management professionals have an impact on the quality of patient information and patient healthcare health services at every point in the healthcare cycle. Health information management professionals ensure healthcare organizations have the information on hand quickly when and where it is needed, while maintaining high standards of data integrity and confidentiality and security. Number 2, health informatics, or HI, is the science that describes how health information is technically captured, disseminated, and used. Health information focuses on information system, informatics principles, and technology when applied in the scope of health service delivery. Number 3, health information and communication technologies, or ICT, health ICT. The technical infrastructure implemented to organize and maintain the security of health information, as well as the exchange of health information in digital form. Professionals working in healthcare ICT focus on the technical side of managing the health information system, using software and hardware to organize and store patient data. This practitioner has an IT background and supports electronic health records, mobile technology devices, and other systems to ensure health information. Here we can see the appendix from Appendix A to Appendix M, and we can see the level pattern from HIM curricula competencies, firstly in entry level, and then the next level is intermediate level, and then advanced level. And this pattern we can see again in the curricula competencies entry level, intermediate, and advanced, and so on. So, ladies and gentlemen, we can see body of knowledge of health information management from American Health Information Management Association, or HIMA. We can see this. And how about Indonesian? In Indonesia, we can see this factor or modality: competency standards, yes, and then graduate profile, and then learning achievement. We can see how PORMIKI, or Indonesian professionals on medical record and health information organization, involved in this schema. And then APTIRMIKI, or Indonesian Higher Education for Health Information Management, concerned in this relation. And then we can see curriculum in the area of APTIRMIKI, Indonesian Higher Education for Health Information, and then competence test tryout, that there is a collaboration between APTIRMIKI and PORMIKI and this competence test. And then we can see registration or registration certificate as a confidence that someone is competent, and then license or work permit. Medical record and health information professional, based on the regulation of the Indonesia Minister of Health number 55 2013 concerning the implementation of medical recorder work, that a medical record and health information professional is a person who has passed the medical record and health information education in accordance with the legislation. Currently, education in medical record and health information in Indonesia are Diploma 3, of Medical Record and Health Information, Diploma 4 or Diploma 4, and Bachelor of Health Information Management. Medical recorders and health information can carry out their work in healthcare facilities, health offices, health insurance, educational institutions, and related services. We can see that 7 competence of health information management professional. Firstly, high professional, ethical, and legal. Number 2, self-awareness and self-development. Number 3, effective communication. Number 4, health data information management. Number 5, clinical classification skills, disease and problems, codification, other health and clinical procedures. Number 6, applications of statistics, epidemiology, biomedicine, and communications. And the last, or number 7, is management of medical records and health information services. One by one, we can see the variable here, designing standards health, contains designing data elements, designing data sets, designing databases, designing structure, designing health data content, managing data and health information, healthcare registration management, health data security design and implementation, management of the release of health information, reporting services and programs. Utilizing data and information to support health services. Number 1, use of statistic for planning health services and programs. Number 2, use of statistic for monitoring indicators of quality, efficiency, and productivity of health services and programs. Number 3, use of statistics as information for healthcare program and service management decisions. Using health information system in managing health data. First, utilize data processing systems and applications, utilizing the system health information, utilizing hospital information system, utilizing the health center information system, utilizing other health facility information system, and then understand the design of information system. Here, the profile of graduate. This compilation based on the PORMIKI and APTERMIKI agreement. PORMIKI is Indonesian Professional on Medical Record and Health Information Organization. APTERMIKI is Indonesian of Higher Education for Health Information Management. We can see for Diploma 3 graduate profile, there are clinical coordinator of Medical Record Unit, Health Information Officer, Healthcare Data Analyst. For Diploma 4 graduate profile, there is Coder Reimbursement, Medical Record Unit Manager, Healthcare Quality Manager, Health Information Analyst. And for Strata 1 graduate profile or profession, there are Case Mix Manager, Medical Record Unit Manager, Healthcare Quality Manager, and Health Information System Developer. For higher education, for Health Information Management curriculum, refers to National Higher Education Standards. We can see this list: Health Information Management, Medical Record Unit Management, Health Information Quality Management, Health Information System, Classification and Codification of Diseases and Health-Related Problems and Procedures, Health Information Technology, Health Research Methodology, Pharmacology, Bahasa Indonesia, Citizenship, Religion, English, Effective Communication, Field Work Practice, Papers, and National Principle. And here we can see in this schema how graduate competence standards will proved by graduate learning achievement. Learning content standards will proved by core curriculum. Learning process standards by lesson plan. Learning assessment standards by competence test. Standards of lecturers and education staff, proved by lecturer and instructor certification. Here, curriculum implementation. Firstly, courses are delivered in the form of theory, practice, practicum, field practice, competency test, certification. Lecturers and instructors involve practitioners. Research, community service, and publications involving the profession. Education, community services and research and collaboration with hospitals, healthcare services. Curriculum evaluation involving stakeholders. Certified lecturer, past learning recognition lecturer. And we can see how curriculum review have done. Basis used for curriculum review, we can see from the first at the left side, competence standard, and then continue with National Qualification Construction Standard, or KKNI, and then split by two things, curriculum and certificate, and then the final or the goals is competent, professional, and high quality health workers. And this schema, we can see how National Qualification Construction Standards at the left side, and then split by main purpose and for key function, and then breakdown as the 13 main function and breakdown as the 81 base function. In the main purpose, organize medical record management and health information in accordance with applicable regulations to produce quality health information and improving public health status. There are 4 key functions. First, manage health data and information in healthcare facilities. Number 2, perform clinical classification, codification of diseases and other health problems, as well as clinical procedures. Number 3, apply health statistics, epidemiology, and biomedical applications. And number 4, manage medical record, services, and health information. For the key function of data and health information management, they perform health data and information management in healthcare facilities. As the main function is designing data requirements in a health information system, managing health data and information, using data and information to support health services, develop a health information system in health data management. The key function for coding, perform clinical classification, codification of diseases and other health problems, as well as clinical procedures. The main functions are using various types of clinical classification system, diseases and other health problems, and clinical procedures, managing health data and information. I'm sorry. Using a healthcare financing system, they are using the basis of clinical classification, codification of diseases and health problems. Number 3, managing clinical codification, statistical data, clinical procedures, and other health problems based on a financing system. And then the key function for statistics, apply health statistics, epidemiology, and biomedical applications. The main functions are manage data on health services and programs, evaluating health service data. The key functions for medical records information management, perform health data and information management in healthcare facilities. The main functions are manage medical records and health information work units, carry out medical record services and health information in healthcare facilities, managing the quality of medical record services and health information in healthcare facilities, maintain the security and confidentiality of health data and information in healthcare facilities. Now, we want to know what is the expectations from curriculum review and graduate profiles of medical record and information management study program. First, mastering data management and ICT, mastering ICT 10, coding and update to ICT 11, mastering the making of digital-based statistics, mastering computerized medical record management. And we can see designing her data standards, designing data elements, designing data sets, designing database, designing structure, designing health data content. And then number 2, managing health data and information, health data security design and implementation, managing the release of health information, and number point C, prepare health service and program reports. Then using data and information to support health services, using statistics for health service and program planning, using statistics for monitoring indicators of quality, efficiency, and productivity of health services and programs, using statistics as information for health service and program management decision making. And the last, number 4, using health information system and health data management, utilizing data processing system and applications, utilizing health information systems, utilizing the hospital information system, utilizing information systems public health center, utilizing other health facility information system, and the last, understanding information system design. Here and in medical record and health information program and Faculty of Health, Jenderal Ahmad Yani, University Yogyakarta. We held curriculum review in this year, 2022. These are our vision and mission. Our vision is producing excellent and leading graduates in the field of coding and electronic medical records at the national level and inheriting the values of Jenderal Ahmad Yani's struggle. Our mission are carrying out education in the field of quality medical records and health information and responsive to advance in science and technology, especially coding and electronic medical records. Carry out superior research activities in the field of medical records and health information based on science, technology, and national culture, and produce innovative products. And then carry out community service in the field of medical records and health information that is efficient and effective. Conduct sustainable cooperation with stakeholders to achieve global competitiveness. And the last, organizing and developing good and independent management or good university governance. Here we can see the schema, and we can compare between old curriculum on 2018. There are 86 credits for institutional, 26 credits, totally 112 credits. And the new curriculum on 2022, core credit are 86 credit, for institutional is 32 credits and totally 118 credits. We can compare these two curriculum graduate profile between old and the new one. The clinical coder profile 1 is converting information from the patient's medical records into an alphanumeric code according to the clinical classification system. And we still use this graduate profile in the new curriculum. It's the same profile. And then the second, medical records and health information unit coordinator is a person who coordinates the medical records and health information unit. And the new one, we still use it profile too. The third, health information processor, implementing data collection to data presentation. Okay, we still use this number 3 profile, and there is additional for the profile number 4. There is electronic medical record manager, who is managers and implementers of electronic medical records and maintaining quality data, security, and patient safety. How about lecturers? Lecturers with strong curriculum background, some of them have educational backgrounds and medical records and health information, as well as health science. Their soft skills, it contains critical thinking, creative, communication, and collaboration. Their role, spreading passion and inspiring students, friends for students, set an example and character, educational competence, competence and research, competence for digital technology, competence and globalization, and competence and future strategies. Here, our learning achievement in medical record and health information program, Faculty of Health, Jenderal Ahmad Yani University, Yogyakarta. I'm sorry. Graduate competency standard in the form of learning outcomes. It covers for achievement, attitude aspects, general skill aspects, aspects of special skills, knowledge mastery aspects. Here, curriculum structure design of medical records and health information. We can see the schema. Here, our curriculum, from the first semester, second, the third, the fourth, the fifth, and the sixth. Because we had a Diploma 3 for medical records program. Thank you very much. And I will return the screen to Mrs. Arin. Thank you very much, Mrs. Arin.
Okay. Thank you so much, Mr. Zacharias, for your great presentation. We get new insight from your presentation about the efforts of the medical record program to improve the learning process, talking about the curriculum. Okay. And now, we move to Mr. Thanapong Intara from Thailand. We will check first. Hello, Mr. Thanapong, are you with us? Okay. Okay. Mr. Thanapong will be joining with us later on. And now, we will answering the question or discussion session 2. Okay. Wait a minute. Let me check first. Okay, wait a minute. Okay, we have several questions here. Okay, the first question is, how does HIMARMIKA Unjaya study program describe the vision and mission into the learning curriculum, and what is the process? Okay. Mr. Zacharias, can you answer now?
Test. Test. Thank you. Test. Thank you for the first question. Can I know the people that asked this question, Mrs. Arin? From where from?
Okay, this question comes from Aska.
Okay, thank you, Aska. Your question is, how does HIMARMIKA Unjaya study program describe the vision and mission into the learning curriculum, and how is the process, maybe, yeah? Okay, the HIMARMIKA study program, Diploma 3, is one of the study programs held at the Faculty of Health, Jenderal Ahmad Yani University, Yogyakarta, which began operation in 2013. The HIMARMIKA study program has a vision of producing excellent and leading graduates in the field of coding and electronic medical records. So, to achieve excellency in the field of coding and electronic medical records, a curriculum that is responsive and in accordance with the needs of the workforce has been prepared and is based on the core curriculum of HIMARMIKA and developed by the study program. The curriculum is structured to achieve the expected graduate profile through the determination of graduate learning outcomes, or we call it CPL, and then which are achieved through an integrated and comprehensive learning process. The learning process is carried out using the student-centered learning, or SCL, approach, both in theoretical and practical learning. 4 members provide real experience to students in the field of medical records. There are also practical field work courses which are carried out together with the partners in the world of work. In the curriculum, there are courses that characterize study programs that support graduate excellence, namely basic computer courses, software application, utilization of health information system, algorithm and programming, databases, computer networks, and so on. These courses are given in the form of theory in class and practical in the laboratory to support the students' learning process. In these excellence courses, Unjaya has provided supporting infrastructure, including a computer laboratory. Okay, thank you, Aska. Maybe it's my answer is enough for you.
Okay, thank you, Mr. Zacharias. Okay, let me check first. We have a question in the chat box from Laras. Okay, hello Laras. Okay, this question is, has the current Unjaya HIMARMIKA Study Program implemented the MBKM program. What efforts have been made to implement MBKM? Okay, so Mr. Zacharias, you can answer now.
Okay, thank you, Mrs. Arin. Thank you, Laras, for your question. I will try to answer your question. Along with the MBKM program, that means Merdeka Belajar Kampus Merdeka, the HIMARMIKA study program seeks to evaluate the MBKM curriculum and transition from a third diploma to an applied degree, so that the study program prepares HIMARMIKA graduates to become experts in the field of medical records and health information. In these efforts, it is necessary to increase the competence of skilled workers to become experts. Expertise SPMIK or health management information professional who originally designed manual medical records. Now there is an increase in skills in designing electronic medical records by interface and also personal medical record, in line with the plan in the learning process to achieve graduates. The HIMARMIKA study program also synergizes, yes, with the industrial sector. That means healthcare, yes, or maybe health programming developer, application developer, and so on. And we prepare it at the first time. Although this MBKM program is not yet fully implemented by now, but we prepare it. Then sometime, anytime when it comes, the time comes, we are ready to implement this program. Okay, maybe it's enough for my answer.
Okay, thank you. Okay, we still have a question now? Do we still have a question? Okay, we will check first. Okay. Somebody is raised hand here. Oh, okay. The next question is from, let me check first. Okay, sorry. From Anissa Salsabila. What are the efforts of the HIMARMIKA study program involving infrastructure facilities to anticipate advance in the field of health information technology? Okay, to Mr. Zacharias, you can answer now.
Thank you, Mrs. Arin, and thank you, Anissa, for the questions. Currently, the available computer laboratory in our laboratory consists of 60 computer units, of which we get the 70 units from Hibah Dikti. Yeah. It will be a complement for our educational program. And the condition for several units has decreased several functions, so that it's not optimal for the latest software installation process to be carried out when the display design process does not match need. But we have a solution about this. Yeah, when we get hibah, yes, aids, yeah, from Higher Educational Directory of Educational Ministry Indonesia, and it is so wonderful. It is also supports the installation programs needed in the practicum of these courses. In addition, for the results of the learning evaluation. At the end of the semester, the distribution of values for supporting courses that use a computer laboratory in the process is obtained to support excellence in the field of electronic medical records, such as basic computer courses with a passing percentage of 82.05%. Graduates from design and management courses with a percentage of 80.48%. 81.39% of computer networking subjects passed. Database course passed 78.03%. The pass of analysis and information system is 79.67%. And the pass of electronic medical record course is 80.97%. In the implementation of practicum and field practice, students are also given skills in accordance with the expected learning outcomes so that students can overcome problems according to their scope of work when they graduate. Students also need to be given real experience in the field, both in the RMIKA, implementation of practicum and field practice. The achievement of competence in the field of skilled of RMIKA is not only the availability of competency curriculum in the field of technology and health information, but also a computer that meets the specification needs that supports the latest application and speed in the programming process. Thank you, Mrs. Arin.
Okay, we still have a question here. This is from our participants who raised hand in the room. First, I give the opportunity to Nur Aza. Hello, Nur Aza.
Hello.
Hello.
My name is Nur. I have a
Please,
question.
camera on.
My question is, how is the curriculum concept from the
Okay,
government?
we can hear your voice here. Sorry. Okay, hold a second. Wait a minute.
Hello? Tes. Tes. Tes, tes. Tes.
Okay, we can hear your voice now. Thank you. Okay. Okay.
My name is Nur. I have a question to Mr. Zakarias. My question is, how is the curriculum concept from the government, in this case the Ministry of Education, translate to the study program curriculum? Thank you.
Okay, Mr. Zakarias, is it clear?
Okay.
From the question?
Thank you, Ms. Arin.
Okay.
From who?
From Nur Aza.
Nur Aza. Okay, thank you, Nur Aza. Your question is, how is the curriculum concept from the government, in this case, the Ministry of Education, translated into the study program curriculum? Okay, I will try to answer your question. The higher education curriculum is a program to produce graduates, so the program should ensure that graduates have qualifications that are equivalent to the qualification agreed in the IKF. The concepts developed by Directorate General of Learning and Student Affairs in compiling the curriculum begin by setting a graded profile, which is translated into the formulation of graduate learning outcomes. The ability formulation Descriptors is stated in terms of learning outcomes, translation of learning outcomes, where competence is included in it or is part of learning outcomes or CP, capaian pembelajaran. The use of the term competence used in higher education from Higher Education Ministry, Dikti, is found in Peraturan Menteri Kebudayaan, the regulation from Educational and Culture Ministry, number 3 of 2020, concerning SN Dikti Article 5. Okay, you can find it in internet. Maybe there are more information that will answer your whole curiosity of this question. And then, okay, when SN Dikti or the CPL formulation is included in one of the standards, namely graduate competency standards in SN Dikti, CPL consists of elements of attitude, general skills, special skills, and knowledge. Elements of general attitudes and skills have been formulated in detail and listed in the attachment of SN Dikti. While elements of special skills and knowledge must be formulated by forums of similar study programs, which are the characteristics of graduates of the study program based on the CPL. The curriculum of a study program can be developed based on Undang-Undang number 12 of 2012 concerning higher education. It is stated that curriculum preparation is the right of higher education institution, but then it is stated that it must refer to national standards. Okay, maybe this is answer from me.
Okay, thank you, Mr. Zacharias. We still have one question, but to all of participants who will ask the question, please don't forget to mention where you come from. Okay, the next opportunity is for Devita Bunga. Hello, Devita Bunga. Don't forget to mention where you come from.
Hello, my name is Devita Bunga. Okay. I'm from Unjaya. I have a question to Mr. Zacharias.
Okay.
What is the degree of Diploma 3 Medical Record graduates at Unjaya? Why is the awarding of medical record graduate degrees different? Does every educational institution have the right to give its own graduate degree? Thank you.
Okay, thank you. Mr. Zacharias, you can answer this question.
Okay, thank you for this question. I will try to answer the question. Your question is about what is the degree of RMIK graduates at Unjaya. Why is the awarding of RMIK graduate degrees different? Does every educational institution have the right to give its own graduate degree? RMIK Diploma 3 graduates have title AMD Perkes, and then AMD PK, and then AMD KES, AMD RMIK, and so on. Why it's not same one another? The degree is usually obtained from university that has a major or a medical record and health information study program. Its campus certainly has its own autonomy in terms of scripting, especially diploma. A degree is usually already listed on the diploma, and it's the right to the graduate to embed the title after his full name as proof of taking studies. Sebagai bukti sudah pernah belajar RMIK. It's just that the above phenomena need to be answered It is in connection with the autonomy that makes every HIMARMIKA campus issue a degree. Of course it is. If a diploma 3 vocational education graduate will hold an associate expert title. But penulisan ya, gelar degree writing. Vocational education graduates holding associate experts are written as huruf A kapital ya, followed by dot, followed by M, followed by lower D, AMD, yes, AMD. A-nya besar, M-nya besar, D-nya kecil, followed by period, so it is written AMD, according to the degree of the Minister of National Education of the Republic of Indonesia. Okay, so for embedding the title of the full name, it will be written for diploma 3 graduates are written in the format full name, ya, comma, space, a.md. For diploma 4 graduates are written in the format full name, space, s.tr, capital T and little r, and then diploma 3 and diploma 4 graduates mean that the writing method is combined with a comma and then a space, yeah. Usually linear between diploma 3 and diploma 4 graduates only write their last degree. On February the 18th, 2020 in Jakarta, a coordination meeting was held between the Association of Indonesian Medical Record and Health Information Management, University HIMARMIKA, and the Indonesian Association of Medical Record and Health Information Professional, or PORMIKI, which resulted in a memorandum of agreement on the naming of the program study and graduate degrees as follows. Yeah. The name of study program, yeah, medical records and health information for diploma 3 study programs, health information management for diploma 4 study program, and this HIMARMIKA degree can be used if you wish to customize it, but it's up to the university. Even if it is not changed, it will not be a problem because it is already stated in the diploma, especially for graduates before this minutes is published, because basically this title is to be used properly for recent graduates for uniformity. This HIMARMIKA degree can be used if you want to adjust it. Even if it is not changed, it will not be a problem, yeah, already. Okay, and the title for graduates from Diploma 3, Medical Records and Information in Unjaya, we use the title AMDKes, Ahli Media Kesehatan. Thank you. Thank you, Mr.
Okay, thank you again to Mr. Zacharias. That's the last question from our participants, and that was excellent points from Mr. Zacharias to answer the question. And now we move to Mr. Thanapong Intara, PhD from Thailand. We will check first. Hello, Mr. Thanapong.
Hi, did you hear me?
Hello, how are you?
Good.
Okay, glad to see you here. Okay.
Thank you.
First, I will read your profile first.
Okay.
I already read your profile from LinkedIn too, Mr. Thanapong. Not only lecturer but also a researcher and entrepreneur. Some of his skill is computer vision, machine learning, cloud computing, and computer science, and he is currently based in Thailand. Mr. Sarapong worked at Department of Statistics Faculty of Science, Konghai University. He graduated doctoral program from University College London at UK. His experience as a lecturer started from 2018 present as a researcher, and he had a lot of publication, and we can see on screen. Okay, Mr. Sarapong, you can start your share screen. You have 30 minutes to present your material. Okay.
Okay. So let me check. Okay, so did you see my chat screen now? Okay, so let me start now. Okay, so today what I'm going to talk about is to share the experience of one of the project that I have been working on, and which is using AI to help in the healthcare information management. So let's start with the problem that we in Thailand got. In Thailand, we have one of the problem is we have the infected by the parasite called OV, which is Opisthochis viverrini. The reason why Thai people got infected by this parasite is because people in Thailand and also people around the Mekong Basin eat raw fish and also raw meat, which contain a lot of parasites. And the problem of this parasite is when it's live in your body for like 10 or 20 years, it developed to be the cholangiocarcinoma cancer, which is a cancer around your bile duct and your liver. So we have the funding to solve this, and we create a program called Brook Free Thailand to eliminate this problem in big picture. So the strategy we do to eliminate the problem start from food. So we have to do research about how to get food without the parasite, and also pet, because pet is one of the medium for the parasite. And then we do here is OB screening. It means we screen people who got infected by the parasite before it developed to cancer. And then we also working on environment as well, because we have to find a way to reduce the parasite in the water. And also we also develop the central data platform that we collect all the data from the OV screening or up until to the cancer treatment. And we also implement some like educational program for people in suburban to know about the danger of eating raw food. And we also have the cancer screening program as well to cure the cancer in early stage, which is better than cure in the later stage. And also we have treatment program, which means we do the like surgical for people who has cancer already. And also we research about policy which we can make this problem, reduce the problem, and also we work on social and also geological. And what I am going to share you today is one part of the strategy which I involve. So what I involve is I I built a system that to to screen the parasite, because it's if we found people who got infected and kill the infected people before it developed to cancer, it's better, a lot better than, and a lot cheaper than like treatment of the cancer. And what we did here is involve three to four strategy, which is the screening and also the central data platform, and also the geological and policy, because we will build the we call dashboard that the management team and also the healthcare team can look at the data and create the policy that fit to the problem or to the area right now. So the team composed of doctor and healthcare professional, and also the AI team and the IT team. And to start with the screening, there a researcher in Thailand, he created a script, which is, this one is similar to the RDT that you use to detect COVID, but for OV we use urine to test it. We test urine, and if people infected by the OV parasite, there will be two line. And apart from the test kit, we also develop the platform, which composed of three important things. First is the mobile application, which used to help data collection. So we want to know when people test, if they're if they're infected, or where are they, or how old are they. And to help user to use the mobile application more easily, we also develop AI, which is artificial intelligence to assist the photo taking and also the form filling. And from this to when people already take and record the data, we keep the data and we bring the data and to build the information dashboard, which have which visualize data in many aspects that I will show you later. So to start, so I start talking about the mobile application that I mentioned earlier. The detail is we develop both iOS and Android, because people who are using, they use different phones, so we have to develop both platforms. And in the mobile application, we have the QR code reader for faster input. So when people have the QR code which contain their hospital ID, when they take the picture with mobile application, the mobile application will read the hospital ID and retrieve the data like the patient name and the patient sex and also age to show in the screen, to ensure that the the strip is from the correct people and the ID is correct. And then we have the camera template. Yeah, we have the camera template to help the people taking the picture correctly. So it will be easier to interpret the result of the test kit. And also inside the mobile application, we have AI as well, which I will talk in the next slide. And the last one for the mobile application is we correct all the data and update the data into the central dashboard in real time. So for some statistics, we start running the program from February this year until today, and the person who use the mobile application is the healthcare, the people in the healthcare unit around Thailand, and about 3,000 users who use the mobile application. And the mobile application has like screened the people around Thailand about now about like 65,000 already. And in the mobile application that I said, we have AI as well. So AI in the mobile application help in three aspects. First, it will ensuring the good image quality, because when we correct the data in the first run, we found that people take the photo like differently. Someone take many test kit in one picture. Someone take it from another picture, you see it from the mobile phone, or someone just take nothing. So we have AI to looking into the picture and see if it's a good picture already. So if it's not, it will ask the corrector to take a picture again. And after we got a good picture, the next AI will the task is to rotating the strip. It means it find the strip in the picture and send to another AI, which is to read the test. Like in the OV test kit, it's not whether negative or positive, but there are like there are level of positive. Like if the line is not so red, it's like it's pinkish. It means it's not infected in the first level, but it's very red. It means it's infected by like the fourth level, which is the highest level. It means there are many parasites in the body. And the latest AI, which is the AI to read the test kit, we got accuracy is above 97% in F1 score, which is the rate of the precision and recall. And when we do everything with mobile phone, all the data will be sent to the central platform, and we combine the data with the geolocation data to draw the dashboard. And in our dashboard, we divided into three aspects. First is the dashboard for management team. So for management team, we will show important metric like how many people got screened and how many positive case, and like here is the average age of people who get into the screening system, and and also the level of infected from many different provinces, and also how about the ratio of men and women, and also different age will have different infection rate, and also divided by province and also healthcare unit, and also on which day people got test more or less. So we can the management team can have a policy to solve the problem, or can plan when we go to do mass screening again. And this example of it is like we show here, like if you use this dashboard, you can just move mouse over the province, and it can say what is the province name and the ratio of infected. For example, this one is called the province is called Mahasarakham, and it show the infected is 53 out of 100%. So you see it's very high infected rate in Thailand. And here is the date, and also it's divided by healthcare unit as well. You can see which healthcare unit got more active than the other. And next, we have the geolocation for management team as well. Here we plot the healthcare unit and the okay, let's see the big picture. So we plot the level of infection and how many tests we already did by we use the size of the circle to represent the number of tests, and the level of red to represent the infected ratio. If it's more red, it means it's more infected. If it's more white, it means it's not infected. And if the bigger circle, it means it's more tests in that area. So we can see which area got more infected, or maybe you can analyze by location. If it's in this location, it might have more potential to got infected. So we can implement have the policy and implement it in the right location and right situation. And next is for the development team. So when we launched it, we didn't know if people will use Android or iOS more, and many other metrics. So we have dashboard for the development team as well to see whether we should improve the Android if no people use or something like that, and how many it's crashed, how many times it crashed, and how many people are using it. So we use this to monitor our system. And this is the number that it's there are about 3,000 users now, and the data is recorded by iOS about 34,000, by Android about 33,000, and we correct the data for about 165 days already. And in the development process, so I talk about big picture of the development process here. So in the development process, we divided into two states. First state is for data collection and user interface testing. We use 4 months for that. So we start launching the application and correct the data and correct how people use the application, and then we use that data to build our AI and implement the new version, which is easier to use. Yeah, and we are in this process, and process is going on now. And this is the the number that the important number is we launch on 15 February and launch about like 150, 120 days. We have about 3,000 user. We screen 62,000 strips already, and out of that 62, we found that 27 people got infected by the OV, and those people got proper treatment. And now we launch on 5 provinces, and 851 hospital and healthcare unit already joined our program. And this is the end of my presentation. So in summary, we try to increase accessibility to healthcare by using AI and big data, and also we use the data to suggest the policy based on real-time data and based on geolocation data, and we try to reduce the OV and also the CCA, and we also try to reduce the resource that if we didn't do anything about this problem, Thailand will have to use resource to treat people who got infected by OV and also treat people who has the cholangiocarcinoma cancer. Yeah, that's it for me. Thank you.
Thank you, Mr. Tanapong. You give such an informative and comprehensive presentation. You know that health information technology improves healthcare quality by processing, storing, and exchanging health information through an electronic healthcare system. Leveraging health information technology reduces costs and improve medical care. And now, ladies and gentlemen, we invite all participants to ask question to address to Mr. Tanapong. Okay, I will check first. Okay, we have a question in the chat box from Amrit1, addressed to Mr. Tanapong. The question is, why should we as medical recorders be technology literate? Okay, Mr. Tanapong, you can answer.
So let me think, why should we
as
a recorder be technology literate? Because now if we want to make a policy that like quick and related to current situation, you need to use the like new technology like mobile phone or internet or like AI big data that will help you got the information that you wanted like in real time. Yeah, and you can see what happened if you implement your policy. You can see the change in real time as well. Yeah.
Oh, okay. Thank you, Mr. Tanapong. The next question is on the screen from Shahna. What is the opportunity of a implementation or coding billing system in the healthcare facilities if the financial and infrastructure are limited? Okay, I'm sorry. I'm sorry for misread the question. It's already answered. Yes.
No, this is another question, right?
Okay. This question is already answered. Yes.
No, this different question. It is the second question.
Okay, because I'm sorry, because your voice is it's not clear here.
All right.
Okay.
So,
The next question maybe from other participants. Okay. Okay, from Emrit 1, why should we as medical records be technology literate?
This one already answered. I think the previous one is not answered yet. So
yes.
The first question, yeah.
Okay. This question is already answered by Mr. Sanapong. Maybe maybe
I answered the first question.
Okay.
Do you mean the opportunity for AI to help in the billing system, right? I think for AI it can do many things, like it can have an AI to detect the fraudulent record, like the record that is mistaken input in the system, and I think nowadays AI is not to implement AI in the system is not expensive nowadays, because if we use like cloud computing, you can limit the resource. You can like say you have this amount of resource, and you can like shape the system that appropriate to your budget and your resource if you use cloud computing, because you don't need like to invest in machine or invest in the people who will monitor the machine, and also the cost of like problem solving if there's something happen in the machine. Yeah, so I think you have many opportunity if you use AI with like cloud computing. Yes.
Okay, thank you, Mr. Sanapong. Due to the limitation of the moment, we have the last question from other participants who raised hand here. Hello, Ambar from Unjaya.
Hello.
Okay.
My name is Ambar. I have a question to Mr. Panapong. How is the development of MRE in Thailand?
Sorry, what? MRE?
How is the development of MRE in Thailand?
How is the development of MRE? What is MRE? I don't know about MRE. So,
or maybe Amber can type in the chat box.
Yeah, please.
Okay, because
Okay, wait a minute.
Okay.
MRE. Yeah, I don't know about MRE. What does MRE stand for? It means medical record, something like.
Okay,
What
how is the development of MRE in Thailand?
So MRE mean medical record, something right? So if MRE mean medical record, in Thailand we try to implement the central medical record platform that everyone use. So it will be one standard, but that is the plan. But what we are doing now is like different party like have different format, but we like send data to each other through what we call API. So it's like if you want this information, you can just send it to the API server to get what information you want and use in the format you would like to. Yeah, now we like keep the medical record in different format by different party, but we have a platform to communicate between each other that can ask for data from different party, and we use it in our environment. It's yeah.
Okay, thank you, Mr. Chanapong Intara. And ladies and gentlemen, we have finally come to the end of presentation. And a great appreciation is addressed to the two speakers, Mr. Zacharias and Mr. Chanapong, for the inspiring presentation. And now, please allow me to take some highlight points. First, the health information management professionals should improve their knowledge and skill based on competencies for ICD 11, and they should aim to lead the healthcare industry into the next generation of health informatics and data analytics. This professional can be found in varieties of settings, including hospital, clinics, and private practice, where they help to connect team members from clinical, administrative, and other stakeholders en route to the proper management of protected health information. And for the last, in the future, AI will continue to evolve and will be widely used as an assistive technology to perform tasks with more accuracy and efficiency with humans in the loop to make final decisions. So what can be done with A1 and big data is increase accessibility to healthcare and suggest policy based on real-time data. Okay, finally, ladies and gentlemen, I would like to thank to all of the speakers, Mrs. Hosisa, Ms. Nick Azliza, Mr. Zacharias, and Mr. Chanapong for their informative and interesting presentation, and also to all the participants for their active participations. Please give applause for the speakers and for you all. Okay. Thank you. So, see you later. And thank you very much. Have a nice weekend. Over to you, Mr. Unsoro.
Thank you, Mrs. Ristiana Eka Arining Tias MPH, as a moderator and bring this discussion to be fruitful. And thank you for all keynote speakers, Mrs. Hoziza, Mrs. Nick, Mrs. Tanapong and Mr. Tanapong and Mr. Zacharias for the fruitful presentation and discussion. Hopefully, our discussion today may become a model or experiences and trigger an ideas for all clinicians and academicians to improve the quality of medical record, particularly on health information management, medical billings and codings. And the next session is the placard handover, and I would like to invite Mrs. Imaniar Seftiani MKM as the advisor of HIMARMIKA to come on the stage, and also Mr. Zacharias Kurnia Purbobinuko MPH as a representative of all keynote speakers that will obtain the placard from Mrs. Imaniar. Okay, we will take the picture first. Thank you, Mr. Zacharias and Mrs. Imaniar, and give a big applause for them. Also, I want to remind all of participants to fill out the Google form links on the chat box. And the next is door prize that will be announced by the representative of committee. Please come here. Time is yours.
Halo Kak Nur, kita balik lagi nih.
Iya dong tentunya. Karena memang pada kesempatan kita kali ini kita akan mengumumkan informasi yang penting ya Kak?
Penting banget, ini penting banget, gak kalah penting dari materi-materi yang telah disampaikan oleh pembicara kita tadi. Kita mau ngapain sih Kak?
Ini dia Kak, sesi yang sangat ditunggu-tunggu untuk peserta-peserta kita nih Kak. Karena kali ini kita akan membagikan atau memberikan informasi untuk peserta yang memenangkan door prize pada kesempatan kali ini.
Bener banget, pasti teman-teman di rumah udah pada deg-degan kan? Siapa sih yang bakal dapetin produk gratis dari Red Eye Cosmetic ini?
Nah, tapi sebelumnya nih Kak, kenapa sih kok peserta ini bisa dapat door prize itu kenapa sih Kak?
Karena kita ambil berdasarkan dari pertanyaan yang menarik ataupun pertanyaan yang terbaik teman-teman. Jadi ada 3 pemenang nih pada kali ini. Siapa aja sih Kak?
Kita
Spill.
langsung bacakan ya Kak ya?
Boleh, biar teman-teman gak penasaran.
Nih, Kak.
Boleh. Oke.
Yang pertama,
pemenang pertama
dimenangkan oleh peserta atas nama
Anissa Salsabila. Selamat kepada Anissa Salsabila.
Nah,
oke. Pemenang kedua, kita sebutin sama-sama lagi Kak. Atas
nama Ambar.
Selamat kepada Ambar.
Nah, ini Kak yang terakhir Kak.
Yang terakhir. Oke, yang terakhir siapa ya kira-kira?
Door prize yang terakhir dimenangkan oleh peserta atas nama
Nur Azal. Selamat kepada pemenang.
Baik, terima kasih ya buat para peserta yang sudah mengapresiasi serta memberikan pertanyaan nih kepada acara kita pada kali ini.
Baik, kami informasikan juga kepada pemenang tadi untuk segera mengkontak panitia ya untuk bisa klaim atau mendapatkan produk door prize ini. Oke, udah segitu aja Kak. Mungkin teman-teman bosan kali ya lihat muka kita. Yuk kita balik lagi ke backstage. Terima kasih teman-teman.
Okay, congratulations for all winners that got a pouch of cosmetic from Red A, FIFA Cosmetics. Be a beautiful women and a gorgeous women next. And the last agenda is closing, but before I close this seminar, we will take the photo together as a documentation of this seminar. And we have 3 pages. We will take every pages. So I beg you can open your camera. Please turn on your camera and give us your big smile. Is it ready, Mr. Gun? Okay. For the first page, we will take the picture. 1, 2, 3. Okay. And the second page. You ready? We will take our picture. 1, 2, 3. Okay, thank you. And the last page. Please be ready and turn on your camera. Give a big smile. We will take the picture. 1, 2, 3. Okay, thank you for all participants. And I would like to say thanks a million to all speakers, keynote speakers, moderators, and all participants today. Also, the sponsor that have supported this event, as well as the committee who have entrusted me to guide this event. And we beg you apologize for any mistakes, either technically or non-technically, and we hope and we will try the best for the next seminar. Like Heraclitus famously said, you cannot step into the same river twice, for other waters are continually flowing on. It means the changes in the science, like in medical record and health information management, are always happen and cannot be stopped. So never miss the next seminar from ISHIM International Seminar in 2023, and see you the next event. Good afternoon, and thank you for all participants and all of person that have supported us. See you at the next event.
Selamat siang. Universitas Jenderal Ahmad Yani Yogyakarta merupakan lembaga pendidikan di bawah Yayasan KTK Eka Paksi TNI Angkatan Darat, terbentuk dari penggabungan Stikes dan Stimik Jenderal Ahmad Yani Yogyakarta. Universitas Jenderal Ahmad Yani Yogyakarta bersesanti Aditya Mahatma Daksa yang bermakna senantiasa menghasilkan lulusan yang pandai dan bijaksana, berjiwa besar, cakap dan ahli.
Sebagai bagian Universitas Jenderal Ahmad Yani Yogyakarta yang dimiliki oleh TNI Angkatan Darat dan membawa nama besar Jenderal Ahmad Yani, Fakultas Teknik dan Teknologi Informasi diproyeksikan menghasilkan lulusan wirausahawan teknologi di era ekonomi digital yang bukan hanya unggul secara akademik, namun juga berkarakter dan memiliki jiwa nasionalisme. Ditunjang dengan fasilitas yang lengkap sesuai dengan kemajuan teknologi, kurikulum yang selalu up to date, dan dosen pengampu yang berkualitas, Fakultas Teknik dan Teknologi Informasi Universitas Jenderal Ahmad Yani Yogyakarta berkomitmen mempersiapkan para Ahmad Yani muda di era ekonomi digital. Saat ini menyelenggarakan 4 program studi, yaitu Prodi Sistem Informasi S1, Prodi Informatika S1, Prodi Teknologi Informasi S1, dan Prodi Teknik Industri S1.
Fakultas Kesehatan Universitas Jenderal Ahmad Yani Yogyakarta saat ini menyelenggarakan 8 program studi, yakni program studi pendidikan profesi nurse, Prodi Pendidikan Prosesi Bidan, Prodi Keperawatan S1, Prodi Kebidanan S1, Prodi Farmasi S1, Prodi Kebidanan D3, Prodi Rekam Medis dan Informasi Kesehatan D3, serta Prodi Teknologi Bank Darah D3. Ditunjang dengan fasilitas yang lengkap dan terstandar sesuai dengan kompetensi keahlian, serta semua prodi telah terakreditasi oleh LAMPTKES. Fakultas Kesehatan Universitas Jenderal Ahmad Yani Yogyakarta siap mendidik dan mempersiapkan para Ahmad Yani muda di bidang kesehatan sebagai generasi penerus kejayaan bangsa Indonesia.
Fakultas Ekonomi dan Sosial Universitas Jenderal Ahmad Yani Yogyakarta saat ini menyelenggarakan 4 program studi, yakni program studi Manajemen S1, program studi Akuntansi S1, program studi Hukum S1, dan program studi Psikologi S1, yang kesemuanya diarahkan untuk menjawab tuntutan perkembangan era ekonomi digital.
Banyak kelebihan yang ada di kampus ini. Dari sistem pembelajaran, metode yang digunakan yaitu student center learning, yang mana mahasiswa dituntut aktif dalam proses pembelajaran. Dosen-dosen yang ada di sini merupakan dosen pilihan dan lulusan-lulusan terbaik. Fasilitas yang ada di sini tidak kalah dengan fasilitas yang ada di kampus lain. Saya bangga kuliah di Universitas Jenderal Ahmad Yani Yogyakarta. Salam mahasiswa.
kebanggaan bagi kami dapat mendidik dan mempersiapkan para Ahmad Yani muda sebagai generasi penerus kejayaan bangsa Indonesia.